America and also in this country before they arrived, people just ate to keep the body nourished. That was the important thing to do. These caucasoids eat entirely too much. I even live next to a Caucasian couple, and both of them are fat. And I'm just telling you, I just see more fat white people than anyone else. Followed by them are the Latinos. There's a lot of fat Latinos walking around too. Y'all seem to be the two groups that are the fattest in the US. Drug-related deaths among middle-aged white men increased more than 25-fold. Wow, that is crazy. Between 1980 and 2014, with the bulk of that spike occurring since the mid-1990s, when addictive prescription opioids became broadly available, according to new research. So this is a study published online today in the International Journal of Epidemiology. Also found, contrary to widely reported research findings, suicide and alcohol-related deaths are not to blame for increasing mortality rates among middle-aged whites. The results call into question the recent reports suggesting that what have become known collectively as despair deaths by suicide, alcohol, and drugs are on the rise among white Americans, particularly men, facing a lack of economic opportunity and an increase in chronic pain. So they're saying, based on pain and distress explanation, raising the mortality rate among the white population, he's not quite buying it. Okay. Instead, recent mortality increases have likely been shaped by the U.S. opioid plague. Masters said metabolic disease, including heart disease, obesity, and diabetes, are also playing a key role. After years of declining deaths for such diseases, thanks to new drugs and procedures, the progress has slowed for men and stalled for women, the study found. When it comes down to mortality, we are just starting to see the real health consequences of the obesity plague. And it is a plague. Seriously, the next time y'all go out in public, just look at the amount of fat white people you see. It's a lot of them. Okay? I would say it's probably just as many out of shape ones, probably even more than the ones that are in shape. But they are more out of shape than anybody else. And I'm glad this man is bringing that out, because for many years they tried to imply it was black people, but I'm sorry. I see more black men that are in shape than I do see white men, and that is the truth. And I'm sure I'm not the only one that noticed that. In fact, I'm more likely to see a black man that is in good shape than I am to see a white man that's in good shape when I go out in public. All I see are these fat, slobbery looking men that just look horrible. Master's and graduate students, Andrea Tilstra and Daniel Simon, launched a study in spring 2016 after papers revealed the following years of decline. U.S. mortality rates had begun to inch up among middle-aged white, non-Hispanic men and women. Follow-up studies suggest such increases were disproportionately driven by chronic liver disease, suicide, and overdoses, which some suggest were symptoms of the same underlying epidemic of emotional distress, economic insecurities, and chronic pain. One study published in 2015 in the Proceedings of the National Academy of Science referred to despair deaths among a lost generation whose future is less brighter than their parents. But we know that. Many people are not living as well as their parents did because the incomes have dropped dramatically for a lot of the same jobs. The despair death narrative caught fire and has since begun to inform mortality research and media coverage and shape dialogue among policymakers and politicians. Yet our research shows it has, he just feels it's incorrect. He doesn't feel these are deaths of despair as it's been labeled. And again, I don't see how it's deaths of despair for them. When Black people have gone through the highest unemployment rate since we've been here. But that's not considered a despair, but it's a despair when white people go through it. Give me a break. Y'all sound weak. For the new study, he looked at U.S. mortality data from the National Center for Health Statistics, the Center for Disease Control and Prevention, and the U.S. Census Bureau for U.S. non-Hispanic white men and women ages 25 to 34 and 35 to 54 from 1980 to 2014, while previous research had lumped men and women 10-year age spans and drug, alcohol, and suicide deaths together. Masters and his team disentangled the data sets, looking independently at genders, individual year ages, and distinct causes of death. They also distinguish between period effects, in which shifts in mortality rates were similar among all age groups, and cohort effect, in which the shifts were unique to individuals born in a particular time frame. One glaring pattern emerged among men and women of all ages cohorts studied. Drug-related deaths had skyrocketed. For instance, in 1980, 1.4 per 100,000 men and 1.76 per 100,000 women died from drug overdoses. By 1998, those numbers had climbed to 9.5 for men and 3.6 for women. By 2014, they'd risen to 36.5 to 24 for men and 24.4 for women. Wow. Y'all some real junkies. Woo. Oh man, I'm looking out the window. This is kind of off topic. I'm looking out the window at the sunrise and the sky is very, very pink out here. I don't think I've ever seen it this pink before. Okay. And meanwhile, the researchers found no substantive increases in white men's alcohol-related mortality at any time. Suicide rates did rise slightly between 1999 and 2014 for men and women, but this was due largely to spikes among all age groups during times of economic downturn. So whenever the economy goes bad or they're not working that much, this is when your caucasoid will turn to suicide. That suggests economic insecurities are not isolated to a single lost generation. But look, Black people have been living through economic insecurities from day one. You don't see us killing ourselves. These people can't handle nothing. With drug-related mortality rates, it took off around the time when prescription opioids became readily available, and it has kept rising steadily ever since, Master says. The team in yet-to-be published research has also looked into the number of Black men and women and seen similar patterns of soaring rates of drug abuse across age cohorts since the late 1990s. We have no doubt that times of economic insecurity have severe consequences for a population's health, nor do we doubt that pain and distress can pose serious health problems, the author concluded. Yeah, but you know what? Black people do soar in drug abuse since the 90s, but we are still not dying at the same rate as the opioid and heroin and fentanyl. White people are dying. Y'all still outpace everybody in deaths. So I don't want him trying to leave that off. We are not dying at the same rate, period. However, taken together, our findings suggest that it is unlikely that recent trends in U.S. white men and women mortality rates have been driven by a plague of pain and rising distress. Instead, the author points to overprescription and overuse of opioid-based painkillers, heroin use, and okay, I'm just seeing what he has here. An obesogenic environment. So he's saying what their findings were when they went in and did a research was overprescription, misuse of opioids, which we know they're overdosing out here every day, heroin use, and obesity. That's what they find as the leading cause of the white mortality rate in this country. And he did not see all this deaths of despair and what they're talking about. He doesn't believe that's what it is. They hope their paper will encourage policymakers and researchers to explore those drivers and their solutions further. Okay, so this man does not agree with the deaths of despair. So he believes that the biggest killer that's happening to white Americans, and the reason why it's rising higher for them than anyone else, is mainly drugs, obesity, and suicide. So that's what's killing white Americans. Please leave your comments and subscribe. And if you can donate to my channel, please do. Peace, family. All right, fentanyl. Drug plague spreading across Mid-South. So things are really getting bad in the mid-southern part of the country now with the fentanyl. Let's go ahead and listen to this video. Where's the sound?
Now the fentanyl epidemic is...
Let me start it all over.
It's a drug 50 times more powerful than heroin, and it is killing people every day in this country.
Now the fentanyl epidemic is hitting home here in the Mid-South. We first told you about the fentanyl abuse in Crittenden County, and tonight we're digging deeper into those numbers. Fox 13's Zach Crenshaw is live in West Memphis right now. Zach, police there told you they're encountering this deadly drug more often than they anticipated.
Yeah, and it hasn't always been that way, Daryl. Last year, fentanyl was hardly mentioned here at the West Memphis Police Department. This year, though, they're making arrests and seizures of the drug and, unfortunately, dealing with multiple overdose deaths. Inside West Memphis PD, the narcotics unit is always busy. But this year, fentanyl has detectives on cases they didn't see last year.
So we definitely have noticed that fentanyl seems to be on the rise for seizures and for overdose issues.
In 2016, West Memphis had 0 fentanyl overdose deaths. So far, there have already been 4 this year.
When you compare it with last year, that's a 400% increase in fentanyl-related deaths for us.
The challenge with powdered fentanyl is it's almost impossible to distinguish from regular heroin. West Memphis police say in the overdoses this year, they've seen pure fentanyl and heroin-laced fentanyl. And they don't think the victims knew about either.
They have no idea how it was mixed, no idea how much is in what they're getting, no idea if the drug dealer, because fentanyl is cheaper, is selling them pure fentanyl.
As a state, Arkansas has seen a huge influx in fentanyl since 2010, and Tennessee is no different. The TBI told me that in 2013, they found fentanyl in lab tests just 12 times. By 2015, that number ballooned to 100, and it doubled last year to 201. Captain Joe Baker said his department is working to go after dealers and cut off the supply, but he also has a message for users.
That a lot of this heroin is being cut with fentanyl, which, if nothing else but for self-preservation, this is a substance that in a very, very small dose can kill you.
Now, less than 2 weeks ago, we told you about how the Shelby County Sheriff's Office was actually training its deputies on how to handle fentanyl if they come into contact with it. That's because if an officer or anyone really gets a small amount of fentanyl, less than a penny, on their skin, it can actually lead to an overdose and a death. It's happened across the country where officers have actually had to go to the hospital when they've come into contact with it. Captain Joe Baker, you heard from in that story, told me that.
Okay, he's right. There is another story that just came out of a cop that overdosed on fentanyl, I think just a few days ago. So he's right. It is happening all across the country. But there's still no end in sight in this plague. The fentanyl, I kind of mix in with the opioid and the heroin only because a lot of it is cut into those drugs to give a more powerful high. And we already know fentanyl is, more powerful. Now fentanyl plague is hitting home in Mid-South. So they're saying just last year, there were hardly no one in Memphis ODing on fentanyl. And just between last year and this year, it has actually jumped up 400% as far as fentanyl-related deaths in the Mid-South. The problem with powdered fentanyl is it is almost impossible to distinguish from regular heroin. West Memphis police said that in the overdoses this year, they have seen pure fentanyl and heroin lace fentanyl, and they do not think the victims knew about either. They have no idea how it was mixed, no idea how much is in what they are getting, no idea if the drug dealer, because fentanyl is cheaper, is selling the more pure fentanyl, which they are in many cases because it's supposed to be cheaper than heroin, I believe. As a state, Arkansas has seen a huge influx in fentanyl since 2010, and Tennessee is no different. The Tennessee Bureau of Investigation told Fox 13 that in 2013, they found fentanyl in lab tests just 12 times. By 2015, that number ballooned to 100. Last year, it doubled to 201. All right. And, the cops always say the same thing. Oh, these drugs will kill you, but it's not going to stop the people from going out there and running after the fentanyl and getting their high. So it really doesn't matter. And it's a shame, but these cops are now putting themselves in harm's way by getting the fentanyl on them. More cops are overdosing across the country, ladies and gentlemen, on the synthetic opioids and all of the fentanyl and carfentanil, and they are coming very close to dying. And it's going to be just a matter of time before many of them will die. I wouldn't want to do this job for no amount of money on this earth. I don't want no contact with drug addicts, period, to be honest with you. To go out there and have a hands-on kind of job with them, I wouldn't want it. Please leave your comments and subscribe. And if you can donate to my channel, please do. Peace, family. Opioid plague grows. So does the number of babies born addicted, ladies and gentlemen. So again, this plague ain't going nowhere. Okay, back in the day when a mother was addicted to crack and her baby was born, the Caucasoids gave them a title called crack babies. All right, that's what they wanted to call our kids, and that's what they did. So Now their babies are coming out in even larger numbers, addicted to opioids because the mom takes the drug all throughout her pregnancy. And listen to how often these babies are born. This is long past crack babies, is what they wanted to call them. Okay, this is in Illinois, DuPage County, Illinois. The I-Team looked into the most heartbreaking development of the opioid plague, tiny lives that begin drug dependent. They can't just say no because they are babies born hooked in a birth fight because of their mother's addiction. Well, that was the same case with the black babies that were born addicted to crack. One baby born every 25 minutes in the United States is suffering from opioid withdrawal. That's a lot of babies, y'all. That's a lot of babies. One every 25 minutes, an opioid baby is born in the U.S. The syndrome has Illinois on the offense. Newborns cry, but one baby's high-pitched wails signal trouble. She entered the world dependent on addictive drugs, among the state's smallest victims of the opioid plague. The symptoms include fevers, irritability, and tremors. A baby you just can't keep from crying. So they actually cry around the clock when they're addicted to drugs. And this is why they keep the babies in the hospital, for fear of abuse from the parents, because it's not like you're going to rock these addictive babies to sleep. It's not like that. It's very different from a normal baby. Okay, a baby you just can't keep from crying, who can't sleep, who's sweating, who's constantly rooting and looking for something to eat or suck, described Dr. Jeffrey Loghead, NICU, medical director of NM Central DuPage Hospital. The use of opioids such as heroin, fentanyl, oxycodone, and codeine during pregnancy can result in withdrawal symptoms most people have likely never heard of. Medical experts call it neonatal abstinence syndrome, or NAS. At Central DuPage Hospital, the withdrawing infant is not alone. In the same week as her birth, 3 other newborns are going through withdrawal, diagnosed with the troubling syndrome. The hospital staff know the drill, and some babies need medicine to help with their pain. Clinical medicine therapists and volunteer cuddlers are also deployed. Okay, so they got people coming into the hospital and actually cuddling and holding these crying opioid babies. Okay. All right, so they're saying just in Illinois alone, they estimate up to 500 of these opioid babies being born a year. In the past few years, we've seen almost 50% increase in the number of cases across the state. The overall number really obscures the fact it's hitting in some communities much harder than others. I think that providers might be one of the first lines of defense in preventing this from becoming a worse epidemic that it already is. It is. If you got a opioid baby being born every 25 minutes in America, it's already an epidemic. It's already a plague. Shoot, that, just like Tareen Rain said, it's a damn plague. So, doctors specializing in high-risk pregnancy watch for women who may be addicted. But while many would-be mothers are not hooked on heroin, a surprising number are still being prescribed habit-forming painkillers while they're pregnant. Why would you prescribe opioids to a pregnant woman? Oh my God, these people are insane. I would never. That is weird. Why would you give opioids, prescribe that to a pregnant woman? And then you want to know why you got an epidemic and babies born this way? Woo, man. The Caucasoid community is really jacked up, y'all. They are going through something real. The I-Team obtained the 2016 data on dependent babies in Illinois, and the numbers are climbing. Between 2011 and 2016, the numbers are more than double in urban counties and more than triple in rural counties. The Illinois actually has far fewer cases of newborn drug syndrome than the national average. Wow. The head of Illinois Public Health and a special committee is now meeting to help physicians and hospitals better identify and treat report cases of neonatal abstinence syndrome. Some babies need tiny amounts of morphine to help with the painful withdrawal. It's a long, drawn-out process of actually getting the baby to a stabilization phase and then working towards a weaning phase. These babies stay in the hospital for a very long time, said the NICU nurse. They have to keep them there because if they go home, those babies are either going to die or they're going to be badly abused because of the crying around the clock that they do. The average hospital stay for a healthy baby costs about $3,500. For babies of drug-addicted mothers, it is $66,000. Oh my God. Whoa. I'm telling you. Now, not only are these heroin and opioid addicts draining the resources, their babies are draining the resources too. So if you have a healthy baby, the hospital cost is $3,500. If you have a baby hooked on opioids, it costs $66,000. Oh my. Woo! America ain't gonna have no money left. Researchers are now zeroing on the long-term effects of being born drug dependent. Wow. Wow, see, I learned something in this article. I didn't know it cost that much money to keep an addicted baby in the hospital. Woo, draining the resources. Now, they've been trying to claim that Black people are on more welfare, although they are on the most welfare, and we were draining the American economy. No, there is no one draining the economy more than these drug addicts and now your babies that are addicted to heroin and opioids. You're the drain on society. Please leave your comment and subscribe, and if you can donate to this channel, please do. Peace, family. This is an article that just came out on Newsmax, and it's talking about the strong comeback that meth is making. In fact, there are some that are projecting that meth may actually overtake the opioid plague that's going on in the U.S. So meth surges in U.S. in shadow of opioid plague. Meth is surging in the U.S. again in the shadow of the opioid plague and may not be getting the attention it deserves, says law enforcement officials. Ohio, one of the main battlegrounds in opioid plague fight, also finds itself fighting methamphetamine's resurgence, authorities told NBC on Wednesday. Texas, Montana, Minnesota, Oklahoma, Iowa, and South Dakota are seeing new spikes in meth. All of a sudden, it's everywhere again, says Wisconsin Attorney General Brad Schmiel, who commissioned a study of meth in his state. It's estimated that meth use there jumped by at least 250% since 2011 and could overtake heroin. We are entering another full-blown plague with meth, Schmiel told NBC News. According to the National Institute on Drugs, methamphetamines is a stimulant drug usually used as a white, bitter-tasting powder or a pill. Crystal methamphetamines is a form of the drug that looks like glass fragments or shiny bluish white rocks and is chemically similar to amphetamines. The Institute said other common names for the drug include chalk, crank, crystal, ice, meth, and speed. The nonprofit news website Oklahoma Watch reported in March that meth was the biggest contributor to drug overdose deaths in the state in 2016. The 952 people who died from drug overdoses in Oklahoma that year was a state record. Meth was connected in 328 of the deaths, up sharply from 271 in 2015, and topping deaths from the much publicized opioid hydrocodone and oxycodone. Their concurrently problematic Jessica Hawkins, prevention director for the Oklahoma Mental Health Department, told Oklahoma Watch about the state's meth and opioid problems. We don't want to what we don't want to do is watch. In other words, what she's saying is you don't want to take the attention off of one epidemic and start focusing on another. A news report by the Oklahoma-Idaho High Intensity Drug Trafficking Area Program said death connected to meth outdistanced that of all other drugs in 2015. The latest data available reported. The report, which blames the increase on the Mexican drug traffickers, said the meth also was involved in the most drug arrests in Oregon in 2016, with 15,308 arrests, doubling from 2009. We're seeing it pour across the border in bigger quantities. And the deputy of the U.S. Attorney General in Southern California told NBC News where meth border seizures in San Diego County jumped from 3,585 kilograms in 2012 to 8,706 kilograms in 2016. It used to be that loads of 20, 30, and 40 pounds were big for us. Now we have 200 pounds loads. Okay, so they're bringing more meth in from across the border. But make no mistake, there are still meth labs all throughout the U.S. They're still making it in these houses. Usually they'll do it in a garage, or I've even heard of apartments where they'll make a meth lab anywhere they can. So, not one, ladies and gentlemen, but two plagues hitting the U.S. And they're not even doing a good job in battling the opioid epidemic and heroin that's going on out here. Now you got to throw in meth that's surging all over the place. I tell you what, I would never want to be an emergency responder, cop, or work for the fire department in this climate out here today. Please leave your comment and subscribe. And if you can donate to my channel, please do. Peace, family. It's been a while since I've done a drug driving story, and here's one that just happened on Saturday in Ohio. Seems to be the heroin capital of the world right now. Man shooting heroin shuts down interstate after crashing into a truck. He actually shot up while he was on the road driving. I tell you, no one is safe around these addicts. Now, it's one thing if you're just an addict. Their addicts are just a public nuisance as far as I'm concerned. A couple is using heroin behind the wheel of their vehicle, force officials to shut down a major highway in Ohio after crashing Saturday morning. Two vehicles collided into a semi-truck at roughly 11:15 a.m. Saturday on Interstate 75 near Cincinnati, Ohio, in what police described as a heroin-related crash. Authorities have not confirmed whether the operator of the vehicle suffered an overdose, but a picture taken by a witness at the scene before first responders arrived show a man and a woman passed out in their car after the accident, reports Fox 19. They probably were already knocked out when they collided into the semi-truck. In a video taken by a witness, a responding officer is seen performing chest compressions on an unconscious man, while a woman, also unconscious, leans on the back wheel of the car. Police said that there were no further injuries from the collision and arrested the driver on charges of operating a vehicle while under the influence of drugs. Officials in the region said they are seeing an increase in heroin-related crashes, which they attribute to the worsening opioid plague gripping the state. Police say that in many circumstances, addicts will shoot up wherever they are when they buy their drugs, which many times is in a vehicle. I said that a long time ago. They don't care where they are when they want the drug. When they're ready for the drug, they're going to shoot it up, whether they're in their house, in a car, in the public. They don't care. I mean, I've seen videos of them sitting on a public bus and shooting up. All right, here's the video related to the crash. I had to look for another site, the Fox 19 site, to find the video. But here it is. Let me go ahead and play it.
This could be that one time where you like the 15-second ad better than the video that follows. Click here to view more offers and access the largest selection of new Toyota inventory. Toyota, let's go places.
Thank you. Take a look at this. Scary moments for a family driving southbound on I-75 near the Western Hills Viaduct. That's where Cincinnati police arrest a man for OVI on heroin after a crash. A witness recalls the frightening moments. This is video after police say a man crashed into a semi this morning. You can see what appears to be an officer administering CPR. Melissa Eiler was riding in a vehicle with her family when she says her father slammed on the brakes.
He hit the brakes really hard, and luckily we wear our seat. So, because
Okay, seems to be a lot of buffering. It's annoying.
could have been a lot worse.
Okay, but for the most part, you can see they had the cop had the driver who was the man
involved in the accident.
You can see in this video another person.
All right, I'm just going to stop that. Okay, so you can see the cop had the driver who was the man down on the ground. He had to do chest compressions on him. And the woman who was also knocked out, she was leaning on the car's back wheel. And you could, in the video, you could kind of see that. So this is a real problem, ladies and gentlemen. Around my way, probably like around May, sometime in May, there was a white male driving a pickup truck, and he went right into one of the light poles out on the street, and he slammed right into that. And it was a whole bunch of cops, the emergency squad, and he was knocked out behind the wheel. Just heroin. So this is happening all over. You have to be careful out there. Unfortunately, these junkies are a public nuisance, and there's a lot of drug driving going on in the country, which really now outpace drunk driving. So tell me what you think in the comment section. Please leave your comment and subscribe. And if you can donate to my channel, please do. Peace, family. A week ago, I did a story on a sheriff in Ohio that refused to allow his officers to carry Narcan. He doesn't feel that it should be the job of the police to revive people. It should be the emergency squads doing that. Well, his refusal to carry Narcan has now sparked protest, and it's very divided. There are some people that do agree with him and some that simply don't. They think that, I guess as a public servant, they should be carrying Narcan. So, opposite corners, opposite views. A protest pushing for Butler County deputies to carry naloxone or Narcan, the medicine used to revive opioid overdose victims at the Butler County Courthouse in Hamilton, drew people on both sides of the issue. They stood across the street from one another, shouting and waving to motorists as they passed through the busy intersection of Martin Luther King Boulevard and High Street in downtown Hamilton. According to the event on Facebook, the demonstration was sparked by comments from Butler County Sheriff Rick K. Jones, who says his deputies have never carried it, and that's not changing. A declaration that drew national press coverage. Deputies and law enforcement officers in surrounding Warren, Clemens, and Hamilton County carry the opioid overdose reversal drug. So you can see in the picture the protesters that are out. Okay, and you see another one down here. Truckers for Jones. Police are not doctors. Heroin addiction can buy their own Narcan. Police do not give medicine. So the town is very divided on this. And you can see some people want the sheriff deputies to carry the Narcan and some don't. Sheriff Jones, have a heart, carry Narcan, saves lives, be part of the solution. Narcan is not a solution, by the way. All that is you're just reviving them so they can go out and get high again. And here's another one. Hey, hey, ho, ho, Sheriff Jones has got to go. Where was all of this when blacks were going through the crack epidemic? I didn't see this outpour from any of these caucasoids that you see today. I didn't see this. All right, there is a video up here. Let's see if we can get it to play. Pardon the commercial.
Used vehicles from 8 franchises in one location at the Jeff Weiler Eastgate Auto Mall on Route 32. Chrysler, Jeep, Dodge, Ram, Chevrolet, Kia, Nissan, and Mazda. Plus, you'll find the used car megastore offers more.
It's an everyday occurrence with these drug overdoses. It's sapping a lot of our police officers off the street because we're constantly going to pretty much the same people over and over again.
If they can shoot you with an Narcan, that will stop the effect of the heroin, and then whatever else it's laced with, you can deal with.
In downtown Cincinnati, I see a lot of people snorting it rather than shooting it up. They don't want to get caught with a needle and get charged then with that needle. Because unfortunately, I can't charge them if they snort it because my drug is gone.
The drug has so much control over them that being Narcan and bringing back to life is not affecting them to stop. They know we're going to come and they know we're going to Narcan them and we're going to bring them back to life.
Hey, here he comes. We're the fire department. We just saved your life.
It's all the time now. I mean, every day, almost, you're coming into a heroin overdose.
I like seeing some type of treatment, just to be honest.
You know, at first, I think a lot of officers did have some compassion. Now it's hard because we see the same thing day in and day out, and there's a lot of individuals out there that do not want help. I mean, I've only had a couple in my career willing to really get help.
It's overwhelming for the firefighters. Big fatigue factor on them. And our goal is to try to get them to the hospital. We can't transport them; they refuse to go.
I feel sorry for the firefighters. They are bringing these people back to life, and then we're done and we walk away because we don't have anything. We can't arrest them. Unfortunately, we can't arrest them for just being high on heroin or because we had to Narcan them. That's not an offense, and there's nothing really we can do. So they walk away. And I think the firefighters get a little frustrated, like, why aren't the police doing anything? But our hands are tied. We can't.
You know, it's amazing how
Shop 2000.
It's amazing how their hands are tied when it comes down to these caucasoids. You know, their hands are tied. I find that very amazing. And I'm offended by that because they're saying if they don't see evidence of the drug and they're just high, they can't arrest them. But they sure did not draw those distinctions when it came down to Black people during the crack epidemic. If you looked high, you went to jail. Whether they caught you with the paraphernalia or the actual drug or not, you went to jail. But they got all these stipulations in place when it comes down to the heroin addict. Oh, well, we can't just arrest them. Well, why not? You just arrested the crack addict. But it's a plague that's affecting white people. So now they want to handle everybody with kid gloves. And I understand what the people that work for these emergency squads and fire departments, you're going out to the same person over and over. I did an article maybe like 2 weeks ago on how they went out for the same person 20 times in 1 week. 20 individual times they went out with Narcan to bring a person back. This is why there was a city councilman that came forward and said they want 3 strikes you're out for these calls, these 911 calls, because they're spending their entire day going to the same people, overdosing over and over and over. And the Narcan, that just brings them back. It only works for like 30 minutes, but it's not curing the drug addiction. As far as I'm concerned, it's encouraging them to do it because they know somebody's going to always come to revive them. So what incentive does the drug addict have to even stop? There's none. This is why this plague is not going anywhere, ladies and gentlemen. I say that on all my videos, and I'm going to continue to say it. And right now, Caucasian society, they're enablers. The ones that are not doing the drugs, they're enabling it because they want these junkies accommodated. Please leave your comment and subscribe. And if you can donate to my channel, please do. Peace, family. All right. This message is for white America. White America, you are not struggling with one plague, but 2 simultaneously. One is the opioid addiction, which we already know you can't get any control over. The second is meth. Both of these drugs are simultaneously plaguing the U.S. at this time. Okay? The leading cause of death in the U.S. is from opioid addiction from white Caucasoid people 50 and under. All right, so you can talk about black on black crime and black on white crime, which is all laughable for you to even bring these things up when your community is being completely devastated by drugs. So you can sit there and be stupid all you want, but the bottom line is this whole epidemic in this country, you can't even control it, and nor can you control your people that are running out here after these drugs. So the way I see it, you don't have anything to say to anyone as long as you got this mess going on in your country. But it's amazing how y'all want to open your mouth to black people when you really have no right to do any of those things at all. So really, this plague going on in the country is well known worldwide. There is no one on this planet that don't know about the bad drug addiction, horrific really, in the United States. While the numbers illustrate the magnitude of the problem, they can also mask the ways in which drug use and abuse is subject to local trends. For the Twin Cities, understanding contemporary drug policy means acknowledging that opioids are the beginning, though not necessarily the end, of law enforcement focus. Although the Minneapolis-St. Paul metro area has seen a notable uptick of overdose deaths, the state has yet to see the grim totals making headlines in Appalachia. In 2014, 319 people died from opioid overdoses. Although the number seems low, it marks an increase of more than 500% since 1999. For years, heroin barely registered on law enforcement's radar in Minnesota. In 2008, the state reported fewer than 10 heroin overdose deaths. By 2015, it had more than 100. The scope of the problem has law enforcement on edge. Although heroin use is up nationwide and the supply of the drug in the Twin Cities has increased, the growth in heroin use has been dwarfed by the resurgence of interest in methamphetamines. Admission to treatment facilities for methamphetamine addiction began to rise in 2010 and quickly overtook the previous records established 10 years earlier. What we are seeing in the data is alarming. Methamphetamine's use is now second only to alcohol for treatment admissions in Minnesota, said the Department of Human Services Commissioner Emily Piper. Although methamphetamines has lost the culture cachet it had in the early 2000s, when the health and safety hazard of living in or near a cookhouse where concerns for many residents, it has not lost its popularity. In May of 2016, police raided a home in Brooklyn Center and northwestern suburbs of Minneapolis and seized approximately 140 pounds of methamphetamines. It was the largest methamphetamine seizure in the state history and the result of a year-long investigation by a multi-county drug task force. So in Minnesota, they're getting slammed by the meth, and in a big way, apparently, in this particular state. But meth is actually growing all over the country. It's now right behind opioids as far as a plague is concerned. 488 pounds of methamphetamine seized by law enforcement in 2016 was nearly 5 times the amount confiscated in 2009. If 2009 marked a low point in the methamphetamine trade, 2016 shows that methamphetamines is again becoming a drug of concern. Not only did 2016 seizures set a new state record, they doubled the amount seized in 2015. In fact, in Minnesota, methamphetamine addiction is second only to alcohol abuse treatment admission, whereas in 2005, the previous peak, 6,703 people were admitted to treatment facilities around the state for methamphetamine addiction. By 2016, the number of admissions stood at 11,555, an increase of 72%. Wow, that's a big jump. The 2016 numbers showed the continuation of an upward spiral that began to accelerate in 2015, according to the state report on drug abuse trends in the Minneapolis-St. Paul metro area, although heroin use accounted for the bulk of drug seizures, arrests, overdose, and admissions to treatment facilities. Methamphetamines was growing in popularity. Okay, methamphetamines was reported in 35% of all drug items seized by law enforcement in the 7-county metro area in 2015, and seizures statewide remained at heightened levels. The report continued. So, look like what they're saying is Minnesota seems to be the state that have the biggest amount of methamphetamines as far as a problem with trafficking and addiction to that drug. In the first 3 months of 2017, the same agency seized 118 pounds of drugs, a trend that, if it continues, would put seizures at more than 750 pounds by the end of the year. Wow. During the height of the previous methamphetamine epidemic, the drug was generally cooked up in local labs. So these are homes that they made into meth labs. And you know what the worst part is? Here in New Jersey, they sold these houses. And when people would move in, the whole family would immediately get sick. And by law, they're supposed to tell you if a house was once previously used as a meth house, but they're so desperate for money that they don't even tell these families anymore. And they don't find out until they move in and everybody gets sick, including the family pets. I have read these stories before. So you have to really just research before you make any purchases or even rent a house out, especially a house, because they're more notorious in doing this in a house than in an apartment. Okay. Unfortunately, Um, so the meth is also sold at a very low cost, which is another reason why it's grown in popularity. The state officials are looking into several possibilities to explain this, including the lack of public awareness of the dangers of methamphetamine use and difficulty accessing heroin. People were aware of the dangers of methamphetamines. Brian McCourt, statewide gang and drug coordinator of the Department of Public Safety, told the Minneapolis Star Tribune. For a variety of reasons, we had other drugs, whether to be synthetic, whether be it heroin, whether it be opiates, come to the forefront, that I think some that anti-methamphetamine messaging has not been heard as loud as it should. Methamphetamines is bad. Taking advantage of federal programs which allow for cooperation between law enforcement agencies and different states, Minneapolis area law enforcement has been able to work with agencies in Wisconsin to shut down a pipeline bringing meth from Chicago into the Twin Cities. However, they realize that the fight is yet over, since new suppliers will crop up to replace those arrested and taken off the streets. And that's the same problem they're having with heroin. As soon as they arrest a whole bunch of people, there's always new people popping up and selling and trafficking the drug. So again, it doesn't matter what they do when they can't even win the battle on the street level. And we already know this from the heroin and opioid plague that's going on. But please tell me what you think in the comment section. Please leave your comments and subscribe. And if you can donate to my channel, please do. Peace, family. Report that just came out on CNN Money. The opioid crisis is draining America of workers. And this goes back to the video I did on how many people are now failing drug tests. I never thought I would see the day in this country where most of the applicants would fail a drug test and only a handful here and there will pass. But that's what's happening now, especially in towns that have a high population of caucasoids. They'll come in, fill out the job application, and just keep failing over and over and over. And this is kept silent. This is kept silent, and this is happening primarily among the caucasoids. They cannot pass a drug test for employment, and it's serious. So serious that many companies are now turning to the Syrian refugees and immigrants coming to this country from Africa. And they're putting them to work because these people can pass a drug test. Where Americans, which they know they're talking about their own people, can't even pass. And a new problem has also cropped up. People that were former drug addicts, did drugs at one time, no longer do drugs, are also having a hard time finding work because people are afraid. These companies out here are afraid to take a chance on them falling off the bandwagon. So you're going to hear more and more former junkies that beat their drug habit, at least for now they did, say they still can't find work. Once people look in their background and see that they had a drug addiction, they won't hire them. So if you had a drug addiction, you better keep it quiet, because if people get wind of it when you're trying to look for work, or you've had some arrest and it was due to your drug addiction, you may have a hard time finding work. No one will want to touch you. So the opioid abuse is also hurting America's job market. The use of opioid has become a factor in why prime-age workers, mostly men, are unable or unwilling to find work, according to a new report by Goldman Sachs. Okay, so it's just talking about the Labor Department data that has recently came out, and it shows a shrinking labor force, which is really going to take a major hit on the economy. See, this heroin addiction is going to impact everything. It has a domino effect because you have primarily caucasoids on the drugs. And they were really the biggest job holders in the country. Now that's all changing. That's all changing, which means economically you're going to bring in the immigrant and pay them less. So although they're making an income in the American economy, they have less to spend because they're not making as much as the white worker would have made. So now the Labor Department participant rate for American men between the ages of 25 and 54 has fallen 10% since its peak in 1954. It currently stands at 88.4, slightly higher than an all-time low of 87.9 in 2014. In addition to opioid abuse, factors such as technology, and aging population, and globalization have also contributed to the declining participation of working age adults in the labor market. But the ballooning use of opioid, whether it is prescription drugs or heroin, is preventing many workers from coming back into the job market, economists argue. Well, there's not very much you can do about that unless you change the labor laws. If you're not willing to do that, a lot of these people are going to be sitting around with no jobs, just like they are now. Boy, I never thought I would see the day where white people would have a hard time hiring their own people because of drug use. Woo, things have changed. The opioid epidemic is intertwined with the story of declining prime age participation, especially for men, says Goldman economist David Miracle. The crisis has created significant costs both to employers and the public sector. All right. So, it's just talking about Ohio blaming the pharmaceutical company for the epidemic and things we've heard before. But there's a video up here. I'm going to go ahead and play this video on how this company in Erie, Pennsylvania could not find workers among their population up there and had to bring in all immigrants to work in their manufacturing company.
Where'd Adam go? This is Ollie. Ollie, he's from Syria.
Hi, how are you? Salam. Salam alaikum.
Sterling Technologies in Erie, Pennsylvania is an American company that needs workers, but has had trouble filling the jobs because local residents are failing drug tests.
I would say we've probably had 20% every time we run a random test, 20% of the people are failing.
It's pretty high.
Yeah, it's pretty high. We're seeing positive tests anywhere from marijuana through amphetamines, right all the way through crystal meth and heroin.
And it's not just here. The percent of employees in the U.S. testing positive for drugs has increased steadily over the last 3 years, reaching the highest level in a decade.
So how many people here are refugees?
Almost everybody that you're seeing here.
At Sterling, refugees have become a hiring solution to the drug problem.
The immigrant workforce that's here has filled a void that we were unable to fill with our local labor pool that we were drawing from.
It's a dynamic that can be seen in many parts of the country, from upstate New York to Ohio, Indiana, and Kentucky. But some companies that work with refugees in these places don't want to talk about it.
They don't want to admit that there is a problem when it comes to drug testing, and refugees are filling that void.
With President Trump's executive order putting a temporary ban on refugees and so much talk about the lack of jobs in the Rust Belt, businesses are in a tough spot, especially when they're in need of drug-free workers like Talib Azamel, a refugee from Syria who arrived to Erie, Pennsylvania last summer. Within 3 months, he got a job at the factory.
احنا بالنسبه لحياتنا يعني ما نعرفش المخدرات، ما نعرفش حتى شلون صورتها او شلون تتعاطى. الكحول نفس العمليه احنا ما بنشربش، يعني انا عمري 45 سنه حياتي ما شربت كحول كمان ولا مره يعني.
In terms of business, how important are refugees to a city like Erie?
I think they're extremely important. I mean, they're the one growing group in the city. You know, it's a city that's been on decline with their population, so it's the only growing group.
The refugees in Erie have arrived to a city struggling economically and dealing with a drug epidemic.
Would you like to be a teacher again in America?
The reality is when business owners are telling you that they can't find native residents who will do these jobs, or they can't find enough people in the community to pass a drug test, what are they to do? They need to seek out employees somewhere. And for now, immigrants are a really good source of that labor.
She's from Cuba and had man's from Syria, United States, Indonesia, Vietnam, 5 countries in this one room right here, yes.
In Louisville, Kentucky, nearly 6,000 refugees have arrived in the last 5 years, helping companies fill jobs.
When we work with, for instance, Kentucky Refugee Ministries, we haven't had any troubles at all with drug testing.
So refugees really are filling that gap for you.
Yeah, in this instance, there were refugees who were available, who were ready to contribute, and we were thrilled to be able to give them that opportunity.
What size? Can you check what size you have? We are going to get you some shoes, okay? Okay, good luck tomorrow. Send us as many as you can. I hear this every single day, whether it's a small local restaurant, coffee shop to Amazon. You know, we get flyers, we get emails, phone calls. We need people.
Okay. What do we remember about work shifts?
We usually get someone employed within 3 days. We've had someone start within 1 day. That's how fast refugees are able to get employed. So the refugees are not taking the jobs. The refugees are filling the gaps.
We spoke with locals about the struggle to find jobs because of drugs.
Right now, heroin and meth is one of the biggest problems.
Recently in Louisville, there were 151 overdose calls in just 4 days. And methamphetamine use is so high here, the number of people testing positive for job drug tests is 47% higher than the national average.
I did crack cocaine and heroin. After trying to get jobs and lose jobs, get a job and lose a job, I said, might as well not try, because I'm pretty sure people want to keep their job. It's just not knowing how to stop.
In Erie, Pennsylvania, we hear similar stories.
I'm 36, and my drug of choice was heroin.
What kind of jobs were you looking for in Erie that you couldn't get?
Like retail, either like small corner stores, any stores like that. They don't give someone like me, they wouldn't give me the opportunity. You know, they just see my background, and that's all they see. They don't see me as a person.
I mean, what do you think of the fact that for these employers, they've had to go to new workers because of the drug problem?
I understand completely. I mean, those refugees, they come here with the American dream in their mind. You know, they come to work, come to build their life. You know, they obviously work hard compared to a drug-addicted individual that just scrapes by, does the bare minimum to get by every day. So I completely understand with the business owners.
I know that refugees need an opportunity when they come here, and employers give them the opportunity. But people like us that live here also need an opportunity. And I'm not saying they don't deserve it, but we deserve it as well.
You know what it is. I'm going to stop it right there, but I will leave the link to this in the description box if anybody wants to see it. See, the drug addicts and former drug addicts, the recovered ones, now got that same stigma on them like prisoners do when they get out and that background check is ran. And if they had any drug arrest or any addictions and stuff on their record, they don't get hired now. They don't want junkies. They don't want former junkies either. So a lot of these people are just as screwed as the ones that get out of jail and can't find work. So ultimately, you're going to have a large population of people out here with no jobs. And you notice how Trump promised all these jobs? Yeah, well, there may be some jobs, but they're going to the immigrants. They sure aren't going to these people. And these are white people. Okay, these addicts, many of them are white, and they cannot get employed now. Like I said before, I never thought I would live to see the day where so many caucasoids are unemployable. Now, they know what it was like for Black people. Black people have always had the highest unemployment, and they didn't care. They didn't care. Now they're experiencing it. And I have to tell you, I don't feel bad for them. They have done Black people like this since we've been in this country, since we've been here. They have always made sure unemployment always was highest among Black people than anyone else. Now the tide is turning, ladies and gentlemen. Things are changing so fast in this country. You know, this Caucasoid man, woman, and child, they are really losing their status, their make believe status of being the best thing since apple pie in this country. But it doesn't look that way anymore. They are definitely a fallen people, more and more each day. Please leave your comments and subscribe. And if you can donate to this channel, please do. Peace, everybody. All right, this story just came out on July 3rd. More Americans are in treatment for opioids, but plague keeps growing. More and more people are being treated for opioid addiction, according to two new reports, but not nearly enough to slow the plague down. Medicaid spending on several prescription medicines used to treat opioid addiction more than doubled nationwide in the last 5 years, accelerating between 2015 and 2016. An Urban Institute analysis of federal data found the vast majority of the money was spent in states such as Pennsylvania and New Jersey that opted into the Affordable Care Act Medicaid expansion. Republican proposals in both the Senate and House would roll back the expansion, but drug treatment spending has emerged as a possible area of compromise, especially for senators in states devastated by addiction. A separate report from the Blue Cross Blue Shield Association found a nearly 400% increase in diagnosis of opioid use disorder in the last 5 years. Both analyses were released last week. Blue companies across the nation collectively cover 106 million people, the single largest chunk of commercial health insurance. But addiction hits the poor especially hard, and the federal government has turned out to be a critical source of funding for treatment. Much of it covered by Affordable Care Act Medicaid expansion. The Blues report also looked at links between opioid prescriptions and use disorders. It found that people who receive high doses of prescription pain medicines, the equivalent of more than 65 milligrams of oxycodone or 100 milligrams of hydrocodone a day, were more likely to end up addicted even when the prescriptions was less than 90 days. I have never had a prescription for 90 days when I was on those pills. I don't think I had anything beyond 7 days. Only 7% of the prescription regimens in the report were for high doses, but those patients were up to 43 times more likely to be diagnosed with an addiction disorder than patients filling scripts for lower doses. The Blues data also show that women of all ages were more likely to be prescribed opioids than men, with the biggest gap among middle-aged patients. But men were more likely to be diagnosed with an opioid use disorder through their mid-40s. Among people older than that, however, women were more likely to run into trouble. Blues subscribers in New Jersey and Pennsylvania were below the national average on 3 measures of opioid use and diagnosed use disorder. Yet members in both states who got treatment were more likely to receive medication that have been shown to reduce the chances of relapse. Rates of opioid use were highest in the Southeast and in Appalachia, the Blues report found, while the use of medicine that helped people stay off drugs was lowest in those regions. The Urban Institute report focused on Medicaid coverage of medications used to treat opioid use disorder or reverse overdose, but it contained no data at all on methadone maintenance, which is regulated separately from all other drugs. Medicaid spending, all right, let me just go down a little. All right, here we go. The report included spending on emergency overdose reversal medication, naloxone, including the brand name spray Narcan, which New Jersey, Pennsylvania, and many other states have made widely available as a lifesaver over the last few years. Medicaid spending on that was up 900 times nationwide. Democrats, moderate Republicans, and a united front of medical organizations have grown increasingly alarmed about the potential impact on addiction treatment and overdose deaths if the Medicaid expansion is rolled back, as outlined in both the Senate and House health care plans. The Wolf administration has estimated that 1/5 of the more than 700,000 Pennsylvanians who have gained coverage through the expansion have used it for substance abuse treatment. According to the Congressional Budget Office, spending on Medicaid in 2 decades would be about 1/3 lower than it is now if the Senate GOP plan were to take effect. That proposal from Majority Leader Mitch McConnell had included $2 billion over 10 years specifically for the opioid plague. By the time senators left for a 10-day holiday break, he reportedly had agreed to moderates' demands for $45 billion. But estimates of the cost of treating Medicaid patients with opioid addiction and disease that can help spread, such as hepatitis C, go as high as $183 billion over the next decade. The trajectory is unknown, says Lisa Clemens Cope, a health economist and co-author of the Urban Institute report. Clearly, treatment is not keeping up with need, even given these big increases. Cutting Medicaid, she said, could have really devastating effects for families and communities and states. Well, I guess pretty soon we should know the outcome of what Trump care is going to be like. And these people are scared. They are scared and they're desperate, and they know if Trump cut a lot of money out of Medicaid, you can wave goodbye to a lot of these junkies. They're not going to make it. And it's not going to be enough funding for states to keep treating these people. So that's a problem. This is why so many of them are putting up a fight over what the outcome is going to be as far as Trump's healthcare bill. So I'll keep you updated. Please leave your comment and subscribe. And if you can donate to this channel, please do. Peace, family. Well, it seems to be happening, everybody. A lot of different communities around the country are now complaining they do not have enough funding to keep a stockpile of Narcan available. And Baltimore is one of the cities that only have like 4,000 doses of Narcan left, and they're not even going to be able to get funding for more until May of next year. And this is really critical because Trump is talking about all kinds of budget cuts, and most of these communities around the country may not even have enough Narcan for the estimated number of heroin addicts that they have in their city. And this goes to show you how heavily they depend on Narcan to counteract the effects of the opioids. So it has gotten to the point where all of these communities around the country are overly concerned about funding to pay for the Narcan. And pharmacies having the Narcan, from what I'm understanding after reading the article, is optional. If they want to stock it, they can. If they don't, it's really not mandatory that any of your CVS or Walgreens or Rite Aids have Narcan available. All right. So it's a big concern. And now they're talking about how Narcan is now $2,000 to $4,500 per dose. Boy, I tell you, these pharmaceutical companies are really price gouging everybody. So now they're trying to figure out how they're going to ration out these last few doses they have. Now, for instance, in Baltimore, they have 21,000 heroin addicts that they're aware of. But right now, they only have 4,000 doses of Narcan left. And they said they know probably by the end of July, they're going to be completely out of Narcan if they're not able to get more funding. So they're spending a fortune on this drug addiction. They are spending a fortune. And it just keeps growing and growing and growing. And of course, everybody is overly concerned about this healthcare bill that's about to come out of the Senate any day now. And it will determine whether it's going to help, which it probably won't, because Trump is talking about all these cuts. And all Trump is doing now is running his mouth about helping the addicts. He hasn't done not one damn thing to help a single drug addict in America. Not one thing. Not one thing. The only thing he did was bring the families there to the White House, just like he did the HBCUs, and did a photo op with them, and then went in there and started cutting all kinds of programs that a lot of these drug addicts depend on, especially through the Medicaid. So he's not really interested in helping anybody. So here's a video. We're going to go ahead and listen to this video.
This makes life worth living, but sometimes life has a plan we can't always see. At South Jersey Radiology, we see what others cannot. The tri-state area's only American College of Radiology Diagnostic Imaging Center of Excellence, SJRA, exceeds state-of-the-art standards for lowest costs, best value, more convenient locations, and care that surpasses university-affiliated imaging practices. Choose SJRA. Get back to living. South Jersey Radiology. Innovative imaging. Radiology reimagined.
And tonight, while we are all watching the fireworks and enjoying them, Police will be watching for any threats. Security particularly tight here.
Okay, that's not what I was. That's not what I want to see. All right, hold on. Let me see if I. All right, let's try it now.
When your doctor prescribes a medical imaging procedure, trust in the doctors and technologists at South Jersey Radiology, because we see what others cannot. The tri-state area's only American College of Radiology Diagnostic Imaging Center of Excellence, SJRA, exceeds state-of-the-art standards. We have more convenient locations with care that surpasses university-affiliated imaging practices. For the best value and lower costs, choose SJRA. Get back to living. South Jersey Radiology. Innovative imaging. Radiology reimagined.
78 people die each day from opioid overdoses. There's a quick-acting antidote to save them called Narcan. This treatment, also known by the generic name naloxone, works in about 5 minutes, but it needs to be administered right away to work. Brain damage can happen in just a few minutes from lack of oxygen. Here's how it works. Narcan knocks out the opioids from the opiate receptors in the brain for 30 to 90 minutes. The victim starts to breathe normally again, and emergency crews can wake and treat them. Narcan blocks a person's high from illegal drugs like heroin and fentanyl, and prescriptions like oxycodone, hydrocodone, codeine, and morphine. By the end of 2016, 1,214 law enforcement departments had naloxone programs. The CDC study finds in 83% of cases, Narcan is administered by other drug users on the scene. It's available as a nasal spray, which costs about $63. It could also be injected into the muscle of the arm, thigh, or butt. The injectable version starts at $15. The drug was first FDA approved in 1971, and the CDC says it has saved more than 10,000 lives between 1996 and 2010. A study in the BMJ shows the drug could cut the overdose death rate by 50%.
Okay. So if nothing changed, a lot of these cities and communities will be running out of Narcan. Please leave your comment and subscribe. And if you can donate to this channel, please do. Peace, family. Okay, y'all. This is a report that came out of CBS in Pittsburgh. The coroners have seen synthetic opiates like fentanyl mixed with marijuana. Now, in my personal opinion, I think this is from marijuana being sold on the black market. Now, I could be wrong, but this is what I'm thinking, because I don't think the norm going out on the street or buying your marijuana from certain dealers, I don't really think it's them. I really think these are synthetic opioids because, fentanyl and all types of synthetic opioids are heavily sold on the black market. And I think that's where this marijuana is coming from, that's laced with fentanyl. So you can tell me what you think in the comment section. I think as long as you're not buying it from the black market, you should be okay with the marijuana out here. So let's get into this story. Synthetic opiates like fentanyl have been found in marijuana, an Ohio coroner said Monday. Fentanyl, which is 50 to 100 times more powerful than morphine, has been attributed to the increasing number of fatal overdoses across the U.S. The drug has been found in other drugs across the country, most notably in Ohio. We have seen fentanyl mixed with cocaine, and that is, y'all, I'm telling you, I live in New Jersey, and I can tell you up in New York, they are dropping like flies. The cocaine users, they're dying because apparently they're being sold cocaine with fentanyl, and these dealers are not telling them fentanyl is in it. So when they go to snort it, they are overdosing, and in many cases, they are dying. The problem is really bad in New York. We have seen fentanyl mixed with cocaine. We have also seen fentanyl mixed with marijuana, said Hamilton County Coroner Dr. Lampme Sam Marco. During a joint press conference with Senator Bob Portman, Republican Ohio, about 300 deaths have already been attributed to suspected opioid overdoses in Hamilton County this year, compared to 403 confirmed deaths through 2016, Sam Marco said. But the Hamilton County Coroner's Office has yet to report any deaths related to fentanyl-laced marijuana. It's nearly impossible to determine which drugs are laced with a synthetic opioid, Sam Marco said. Essentially, the message we've tried to get out there is if you are using any form of street drug, count on them having some form of synthetic opioid mixed in, she said. The U.S. Drug Enforcement Administration spokesman Melvin Patterson said the agency has not confirmed the existence of fentanyl in marijuana. In regards to marijuana, I'm not familiar with that, he told Cincinnati Enquirer. There could be. The Ohio Coroner's Office in Montgomery County previously ran out of space for dead bodies twice this year due to the opioid plague. A record of 3,050 Ohio residents died from the fatal overdoses last year, most of which were caused by heroin or painkillers. Tell me what you think. Personally, like I said, I believe this is black market marijuana that people are buying, and it's laced with fentanyl. But you just tell me what you think. I'm going to go ahead and play this video.
Deaths from prescription painkillers have more than quadrupled since 1999, according to the Centers for Disease Control.
Health reporter Stephanie Stahl is here now with what experts say could help lessen the opioid addiction.
That's right, guys. 91 Americans die every day from an opioid overdose, according to the CDC. Doctors are looking at alternatives to addictive prescriptions for treating pain. And with medical marijuana legal in many states now, advocates say legalizing it across the country could help curb the nation's drug crisis. Christine Stenquist suffered through a brain tumor, fibromyalgia, and debilitating headaches, chronic pain, which led to 45 different prescription drugs.
Migraines were just constant. So they started me on a lot of pharmaceuticals, and that went on for about 16 years.
Between the pain and the opioids, the mother of four was left bedridden. Eventually, she decided to give medical marijuana a try.
This is just a whole different lifestyle. I'm eating healthier, I'm more active, more alert.
Stenquist is one of a growing number of Americans who've traded in their powerful and addictive painkillers for the green alternative. Research in the Journal of the American Medical Association shows in states where medical marijuana is legal, opioid overdose deaths are down as much as 25%. The DEA still warns of a high potential for abuse, and Attorney General Jeff Sessions has described marijuana as only slightly less harmful than heroin.
I reject the idea that we're going to be better placed if we have more marijuana.
But Carla Rosati Vasquez treats pain patients and disagrees.
I've had patients that since they have been using their vaporizers with cannabis, for example, they've decreased their use in Ambien, they've decreased their use on clonazepam, on Percocet. Within 6 months, I was driving. Within 8 months, I was trying to figure out how to pass a law in my state.
Stenquist knows in her home state of Utah, that could be an uphill battle. Now, medical cannabis is legal in 29 states, including here in Pennsylvania, New Jersey, and Delaware. Those programs provide access to patients with a legally approved serious medical condition, and they have to have a prescription.
Okay. Tell me what you think in the comment section, ladies and gentlemen. I personally, like I said, I think this is
just an hour south of Pittsburgh in the Laurel.
That won't even turn off. Okay, just tell me what you think in the comment section, ladies and gentlemen. Please leave your comments and subscribe. And if you can donate to this channel, please do. Peace, everyone. Me recently and said, why don't I talk more about black on black crime? Because black on black crime is not the leading problem in America. Although you Caucasoids in your propaganda machine, the mainstream media, try to make it appear that way. But some of us that are way, way more awakened and we are aware of what's going on in America, you're not going to pull that one over on us. So if you need to hear about black on black crime, I suggest you go to another channel. On this channel, we are going to focus on what the biggest problem is in America, and that is your opioid plague. Not only is it a problem, ladies and gentlemen, in America, it is the biggest drug problem on earth. America leads the world in drug overdose deaths by a lot. And this article came out on Vox.com, June 28th, 2017. America has about 4% of the world's population, but 27% of the world's drug overdose deaths. That, ladies and gentlemen, is pretty sad. America has the biggest drug overdose deaths in the entire planet. And these are mostly Caucasoids. Black people are not leading in drug deaths in America. Not even close. We're not even close to you. Although you're trying to make the 4% of the black people that are on opioids a big deal, but we know that's not a big deal. Your deaths have far exceeded that. That's one of the startling conclusions from a recent report by the United Nations Office on Drugs and Crime. Statista charted the results, and as you can clearly see, the U.S. is in the lead. North America, so this now filters in Canada because the Caucasoids up in Canada are also having a problem. And as you can see, all the way down the chart, do you know South Africa is also having an opioid problem, ladies and gentlemen? They deserve it. They deserve it. Okay. The U.S. has always been ahead of much of the world in drug overdose deaths for a variety of reasons. For one, Americans are relatively wealthy, so they can afford to buy drugs. But there also appears to be a cultural and socioeconomic factors at play, driving a broader increase in deaths of despair, such as suicides, alcohol, drug overdose deaths in recent years. And we know all this stuff. Oh, jobs went overseas, poor healthcare access, that kind of stuff. We already know that. But recently, America has gotten much worse in its massive opioid plague, which has contributed to a huge spike in drug overdose deaths over the past decades. In 1999, fewer than 17,000 people died from drug overdoses. In 2015, that grew to more than 52,000 people. This is why I don't talk about black on black crime, because black on black crime is not the problem in America. It is the Caucasoids on drugs is your biggest problem in America. Not only are you the biggest junkies, you are the biggest nuisance out in society. Your drug addicts are causing all kinds of car accidents. They have killed people out on the road. They have injured people. They have jumped the curb and ran people over. Your junkies are robbing pharmacies. They're robbing banks. They're robbing people's homes. So you're not just being a drug addict, but being harmless to everybody. You are being a complete nuisance and also a killer as a junkie. That's the problem, not black on black crime. This is, for now, largely a white American problem. Okay, I'm going to throw it in there because that's what it is. After pharmaceutical companies heavily market their opioids in the US and doctors followed through with massive numbers of prescriptions, America became the world's leader in consuming opioids, with UN data putting the US at the top of the opioid consumption. And as you can see in the dark blue on top, America just trumps all other countries on earth when it comes down to drug overdose deaths, including Canada. Canada's right behind because they're part of North America. The same drugs that are being trafficked into America is being brought into Canada as well. Okay, these folks have no right to talk to any black person about black on black crime or this fabricated black on white crime and all this other stuff that you could try to put on the black community. Okay, calling us niggers is not the worst thing that can happen, but your drug deaths are certainly far worse than being called a nigger, okay? So all of your little bags of tricks that you got is just simply not going to work. And I laugh because, see, these caucasoids are also upset because the world don't like them like they used to. Not only are they taking a lot of criticism here in America, they're taking a lot of criticism outside of America. They're getting called out on a lot of things. And they are so fragile. They are upset that the world just don't love them like they used to. And it serves them right. What have you done to deserve to be loved by everybody? Not a damn thing. So what you're getting, you deserve every ounce of it. Okay, America leading the entire globe in drug deaths, ladies and gentlemen. Pass it on, ladies and gentlemen, pass it on. But don't let them get in your face again with no black on black crime. That's not leading in anything in America. I don't care how much they keep trying to fake it up on their media. All right, the two charts then are closely tied as America consumed more opioids and the drug overdose deaths climb. So it began to dominate the world on a very grim statistic. Okay, so in 2015, Americans died of drug overdoses more on that year than, any other time, which was 52,000 deaths. And that same year, there were 38,000 people that died in car crashes, 36 died from gun violence, 36,000 died from gun violence, and 43,000 and HIV/AIDS during the epidemic's peak in 1995. So they have far exceeded any black on black crimes that another black person died at the hands of a black person. Black on black crime deaths have pretty much been leveled for the past few decades. The last time I looked, it was like 4,300 black people died at the hands of another black person. And they got the nerve to make a big deal out of that when 52,000 of them died in 2015. And they got the nerve to come and talk about some black on black crime. These people are a joke. They are so stupid. This is the latest drug plague, however, is not solely about illegal drugs. It began, in fact, with a legal drug, and we know that. The doctors prescribing the opioids, and then they turn from that to the heroin and the fentanyl out on the street. We know that. That's like old news for people on my channel. Painkillers proliferated, landing in the hands of just not patients, but teens rummaging through their parents' medicine cabinet. You know what? When I was a teenager and my parents were on medicine, because I had both my mom and dad in the house. I didn't grow up in a single family home that a lot of you caucasoids also try to imply by Black people. We all have fathers, okay? We couldn't have got here without a father. I never thought of rummaging through any medicine cabinet looking for drugs to take. I just never did that as a teenager. In fact, I hardly wanted to take a pill. Okay, I was not one of those people I barely want to take one now. I would prefer to use a natural remedy over taking a whole bunch of pills from a doctor. So that's their teens doing that. I don't believe it's a lot of Black teens doing that kind of stuff. Other family members and friends of patients and the Black market. As a result, opioid overdose deaths trend upwards, sometimes involving opioids alone, other times involving drugs like alcohol, benzodiazepines. By 2015, opioid overdose death totaled more than 33,000. Close to 2/3 of all drug overdose deaths. And you can see on this chart from New York Times how it's trend upward. And they're now projecting that 65,000 people have died from drug overdose deaths in 2016, but those numbers will not be out until December. Seeing the rise in opioid misuse and death, officials have cracked down on prescription painkillers. Law enforcement, for instance, threatened doctors with incarceration and the loss of their medical license if they prescribe drugs. Yeah, well, we've seen this already. I already did a story on, was a woman doctor, a white female doctor, and she got arrested for writing all types of scripts for opioids for people that didn't even need them. So we have seen this already. And she lost her license. Okay, ideally, doctors should still be able to get painkillers to patients who truly need them. After, for example, evaluating whether the patient has a lot of history of drug addiction. But doctors who weren't conducting even such basic checks are now being told to give more thought to their prescriptions. Yet many people who lost access to painkillers are still addicted. Some who no longer obtain painkillers, so we know they turn to street drugs that can't get a script from their doctor. And we've heard that a million times. All right. That doesn't mean cracking down on painkillers is a mistake. It appeared to slow the rise in painkiller deaths, and it may have prevented doctors from prescribing the drugs to new generations of people with drug use disorders. Now listen to this. This is what I found interesting, but likely solution is to get opioid users into treatment. But listen to how many they got into treatment in 2016. According to a 2016 report by the Surgeon General, just 10% of Americans with a drug use disorder obtain specialty treatment. So the other 90% remained out here running around on drugs. And remember, only 50 to 90% of the time they are successful in kicking the habit. I'm sorry, 50 to 90% of the time after treatment, they go back to the drug within the first week after finishing rehab. So it might be 10% that went through the treatment, but I bet you that number is very small as far as how many actually stayed off the drug after treatment, because most of them go right back to the drug. So treatment is really not effective in America. They have to really want to be off of the drug and go back to living a normal life. And that is extremely difficult. Okay, so difficult that the average drug addict does not achieve it. So federal and state officials have pushed for more treatment funding, including medication assisted treatment like methadone. Okay, well, some states such as Louisiana and Indiana have taken a tough on crime approach that focuses on incarcerating drug traffickers. But the incarceration approach has been around for decades, and it hasn't stopped the massive drug plague like the current crisis. So please don't come back with the black on black crime and post that. You guys don't see it, but I do when I go through the messages to approve them. They always got something in there either pertaining to niggers and this and that. And niggers are not the problem in America, okay? The problem is the Caucasoid community and your drug addiction. That is the biggest problem in America. It's not black on black crime. It's not anything black people are doing, in fact. It is a Caucasoid American problem, and it is the biggest problem on earth. You just want me to talk about black on black crime so you can feel all good and fuzzy on the inside, and I'm not going to do it because that's not the leading problem in America. Nor has it ever been the biggest problem in America. So I don't care how much you keep trying to talk about it, and your Nazi media keep trying to talk about it too, because I dismiss both of you. So if you are interested in black on black crime, then you need to seek out a coon on YouTube and go sit yourself at their channel and listen to them. But I have a certain agenda on my channel, and that agenda does not include black on black crime. And if I did want to talk about black on black crime, I will talk about that to black people only. Not you. Please leave your comments and subscribe. And if you can donate to my channel, please do. Peace, family. I'm giving you an update on the Ohio councilman that made the suggestion of not responding to drug overdoses after hearing from the same person 3 times. You know, because these addicts, they actually overdose multiple times during the week. So it's not like they have one overdose and then they're good, maybe for the rest of the month. No, some of them have, I did a story where the cops responded to the same person 20 times. Okay, they had 20 overdoses, and hospitals are also saying that they see the same person sometimes every single day because they're overdosing every day. So that's a problem because, you know, you keep seeing people like that, you're going to run out of money in the budget. You're going to run out of Narcan. You're going to run out of any type of money where you can't even do other things for the city because you're spending it all on these drug addicts. So I kind of see his point. And there's a lot of people blasting him. He's getting hate mail across the country from different people. But I think in due time, a lot of people are going to start agreeing with him. Ohio councilman sparks fury after asking if EMS can stop responding to overdoses. One question touched off a firestorm of outrage and turned an obscure Ohio City councilman into the target of anger. Is the city legally required to keep dispatching ambulances to rescue drug addicts who repeatedly overdose on opioids? Councilman Dan Pickard has been blasted as heartless and cruel, and Middletown, Ohio city officials said they have been getting hate mail from across the country ever since he proposed the question during a recent city council meeting. Frustrated by the fact that the city has already spent 10 times the $10,000 it had budgeted for an overdose medication, Narcan, and saying they need to think outside of the box, Pickard asked the council meeting last week whether there was a legal and ethical path that would allow us to legally choose to respond or not to dispatch. In an email to NBC News, Pickard on Friday admitted the people whose opinion he values the most, his constituents, are divided over his proposal. I would say the ones I have heard from are split 50-50, he wrote. Those who agree with him do not want others to know their position, he added. Yesterday I was in court. I heard from 15 attorneys, 11 deputy sheriffs, and 4 judges who went out of their way to support me, but cautioned against using their names publicly. Everyone is afraid they will be attacked like me. But Pickard also bristled at the suggestion he is a heartless bean counter. I am not putting money ahead of the well-being of people, he insisted. The problem is there is no money. City manager Douglas Atkins wrote in a letter published on the city website that Pickard opened that there could be a system to be later considered that would divert overdosing addicts from jail and into community service and treatment. Pickard also made the point that people with cancer don't get free chemo from medics, nor do people having heart attacks get a free bypass in an EMS run. And Pickard suggests slapping a person whose overdoses with a summons to do community service and work off the costs of EMS runs and Narcan. John Smith obviously doesn't care much about his life, but he expending a lot of resources, and we can't afford it, Pickard told the local Journal News. That kind of talk outrage advocates for a humane treatment of drug addicts. Truth Farm, for instance, said it was appalled by Pickard's suggestion. It pains and infuriates us to see how easily you have turned human lives into dollar signs and an impact on your budget, the group wrote. Noting that Pickard is not running for re-election, Truth Farm said that it doesn't erase your responsibility to the people you currently serve. To suggest that you withhold emergency medical response to overdose patients is manslaughter at its best and premeditated murder at worst. Oh my goodness. Oh man. It's just amazing how they'll fight tooth and nail for these addicts because they are cockazoids. I don't recall any of these people being outraged when crack addicts were being thrown into prison. See, this is why it's hard for many people to feel sorry for these heroin addicts. I, for one, I don't feel sorry for them. I really don't. Y'all can keep sugarcoating it and calling it a public health issue and trying to get everybody to be sympathetic towards these addicts. I'm sorry, it's just not there. Faced with such fury, Atkins took the unusual step of going online to explain that Pickard only made an inquiry and no change of policy was voted on. Councilman Pickard's comments went viral. Wow. And we've received hate mail, national news coverage, and overloaded voicemail and email inboxes, he wrote. But Atkins wrote, nothing has changed. We have not considered or adopted any change to our method of responding, to opiate overdose calls, he wrote. We respond and render aid every time. Middletown is a city of approximately 45,000 people, about 90 miles west of Columbus. It has seen a sharp spike in overdoses. So far, this year, Middletown paramedics and police officers have responded to nearly 600 overdoses, 54 of them fatal. The city's fire department confirmed. Last year, there were 532 overdoses and 74 of them resulted in death. Pickard said sooner or later, Middletown is going to face a fiscal reckoning. No, you know what the whole country is. The whole country is. Right now, these heroin addicts and these opioid addicts are like a money pit. It's like you're pouring tons of money into this plague, and there's absolutely no return on that money. So you are literally losing tons of money going out for these people. And remember, everybody in this country have a limited budget every year. They have like a set amount of money they can spend in their budget. If you are running out of money, that's a problem. And there are places, when I was reading a few articles online, they get their fiscal budget in July. And because of the drug plague that's going on, a lot of these states and cities across the country are running out of money by December. I mean, how long are you going to keep doing it? So if you don't want them to get help through the ambulance service, or if you want them to get help, then what's the other alternative? The other alternative would be to put them in jail. But y'all don't want to do that. And it's also written that it costs more money dealing with heroin addicts in jail than any other inmate because they require so much treatment. And even when you get them off, a lot of them are coming in there with all kinds of diseases like hepatitis C. Many of them got AIDS. Many of them have all type of infectious diseases now, hepatitis B, tuberculosis. So you're not only treating them for the drug addiction, you're treating them for any infections they got. And if it's a female and she's pregnant, you got to now treat her and then treat the baby when the baby is born. They said it costs the average prisoner to house in jail about $50,000 a year. Okay. They said it costs the average heroin addict $75,000 or more, depending on their condition. That's outrageous. And they have to treat all of these people while they're in prison. So, it's a fortune, even whether they're in jail or outside of the jail. It is costing the country a complete fortune in trying to accommodate all of these addicts. And they've got to take that into consideration. It's going to be a problem everywhere, not just in Ohio. Whether my plan is implemented or not, the city will soon run out of money, he wrote to NBC News. No money for squads, no money for gas, no money for drugs, no money for paramedics, no money for anything, because it will all have been spent on OD cases. As I said before, I believe there's going to be a lot of people jumping on the bandwagon with this man soon enough. It just not enough time has passed yet. There's going to be a lot of people singing a whole different tune out here when they realize how much of their tax dollars are going towards these addicts. A lot of people don't appreciate that now. So I really believe, he's on to something, and I really believe in time you're going to hear people in other states making the same suggestion. Then all people in need of emergency care will suffer, and heart attacks will kill people, car accidents will kill people, and people will die of other injuries. Yeah, because they're draining all the money, and in time, how are you going to pay your cops and your EMTs and your fire? You're not going to be able to pay people. Pickard added that he's open to other ideas and added, our city does not own a money machine. So please, I think he's on to something. I don't disagree. I don't disagree. And personally, I don't want all my money going towards these junkies, my tax dollars. I want, money to go towards other things. You got to have money for education. You got to have money for running your schools. You got all types of things within the community that also requires money. And he's right. You're draining the resources on people that don't even want to get better. They're not trying to get better. They don't want treatment. They're just going to continue to OD over and over, and they don't care. They don't care about anybody but themselves. Please tell me what you think. Please leave your comment and subscribe. And if you can donate to this channel, please do. Peace, family. 2 days ago, I did a story on a councilman in Ohio that wanted to do a 3 strikes rule for overdose victims because they are going out repeatedly over and over and over to the same people, overdosing all week long. This story takes the entire cake, y'all. Thanks, Craig Jarrett, for sending this story. Police revive same man from an overdose 20 times. Can you imagine using Narcan on the same person 20 times because that's how many times they've overdosed? An Ohio police officer says one man has been revived from an overdose by naloxone 20 times by police. So that's 20 different calls because this person overdosed. But he still disagrees with a city councilman who asks if it's possible for emergency crews to stop responding to drug overdose calls. And these are repeat offenders. So it's not overall all drug overdose calls, just the repeat offenders. An Ohio police officer says one man has been revived with the opioid overdose antidote, naloxone, 20 times by police. But he still disagrees with a city councilman who asks if it's possible for emergency crews to stop responding to drug overdose calls. Dayton Police Major Brian Johns tells the Dayton Daily News law enforcement took an oath to protect life. Oh my goodness. Really? Well, y'all must have amnesia on them oaths when you're dealing with black folks. but okay. Comparing the situation to a first responder not doing CPR on an obese person because they have poor dietary habits. Middletown City Councilman member Don Pitcairn said last week arresting people who overdose increases the burden on taxpayers and strain the court system. You know, it's amazing how they react like grabbing one of these junkies and putting them in jail is like kryptonite. That's all they did during the crack epidemic and was happy to do it. But it's almost like a sin for them to even think about jailing these heroin addicts. You know why? Because it will automatically trigger white mass incarceration, and they know it. This is why they are doing everything going above and beyond not to mass incarcerate these heroin addicts, because they will literally be the only ones in jail. They'll be the biggest population there. Everybody else will be small in size, and they're not about to let that happen. They don't want to mass incarcerate caucasoids, but it's happening already. If you remember, I did a story on now white women are outnumbering Black women in arrests, and a lot of it is due to the drug addiction, because they end up committing crimes out of desperation and trying to get their hands on the drug. Pickard is standing by his comments. We need to put a fear about overdosing in Middletown. So there you have it. You got one man that have to be revised up to 20 times by the police because he has overdosed that many times. That is outrageous. Okay, I don't know how any city budget would survive, and I'm sure he's not the only one. They have to go out to multiple times. That's why this councilman is making the suggestion. So you factor in all the other people that are repeat offenders and need Narcan several times in a week. That's outrageous. That is very expensive. And now you're talking about Narcan. The pharmaceuticals are now going up on the price on top of everything else. I don't know. Tell me what you think in the comment section, everybody. Please leave your comments and subscribe. And if you can donate to this channel, please do. Peace, family. Before we get into this article, I just want to tell you something that I was laughing about yesterday. I had pulled up a few articles on fentanyl. And I looked down in the comment section. Do you know the majority of the caucasoids in the comment section were saying they think this entire plague is a hoax? It's not really happening. It's a hoax. I said, that's good. That means that you're not going to be paying attention. And by the time you do pay attention, the damage will be already done. The damage is really done now. Okay? Because they sure can't reverse it. But they're sitting around talking about it's a hoax. And it wasn't just one person. It was probably the majority of the people in the comment section saying this. They don't believe this is really happening. They believe it's a hoax. That's fine. It makes it that much sweeter when you fall. This article just came out on Stat News, June 27th, 2017. Stat forecasts opioids could kill nearly 500,000 Americans in the next decade. The rate they're going, I don't know. Do they even have a decade? Opioids could kill nearly 500,000 people across America over the next decade as the crisis of addiction and overdose accelerates. Deaths from opioids have been rising sharply for years, and the drug overdoses already kill more Americans under age 50 than anything else. Stat asks leading public health experts at 10 universities to forecast the arc of the plague over the next decade. The consensus, it will get worse before it gets better. It ain't going to ever get better. There are now nearly 100 deaths a day from opioids, a swath of destruction that runs from Tony, New England suburbs on the farm country of California, from the beach towns of Florida to the Appalachian foothills. In the worst case scenario put forth by stat experts panel, that toll could spike to 250 deaths a day if potent synthetic opioids like fentanyl and carfentanil continues to spread rapidly, and the waits for treatment continues to stretch weeks in hard-hit states like West Virginia and New Hampshire. If that prediction proves accurate, the death toll over the next decade could top 650,000 people. Wow. That's almost as many Americans as will die from breast cancer and prostate cancer during that same time period. Put another way, opioids could kill nearly as many Americans in a decade as HIV/AIDS has killed since the plague began in the early 1980s. The deep cuts to Medicaid now being debated in Congress could add to the desperation by leaving millions of low-income adults without insurance, according to the nonpartisan Congressional Budget Office. Even the more middle-of-the-road forecast suggests that by 2027, the annual U.S. death toll from opioids alone will likely surpass the worst year of gun deaths on record, and may top the worst year of AIDS death at the peak of the epidemic in the 1990s, when nearly 50,000 people were dying each year. The death toll across 10 forecasts nearly 500,000 deaths over the next decade. Beyond the immeasurable pain to families, the overdoses will cost the U.S. economy hundreds of billions of dollars. See, this is why you're hearing about the article that I did before about the lawmakers saying, cut these people off. They're a drag on all of the resources, and they really are. All right, so this is their prediction chart. Wow. Okay. All right, a sort of interactive chart. All right. Okay. In addition to the forecast provided by academics who specialize in epidemics, so what they're talking about is clinical medicine, health economics, and pharmaceutical use stats. Conducted more than 40 interviews with politicians and patient advocates, providers, and payers, doctors, and drug makers. This analysis is also informed by a review of presentations from top Trump administration health officials, including Health and Human Services Secretary Tom Price, National Institutes of Health Director Francis Collins, and the acting chiefs of the Office of National Drug Control Policy, the Substance Abuse and Mental Health Services Administration, and the Center for Disease Control and Prevention. It took us about 30 years to get into this mess. Robert Volek, professor at the University of Colorado, Denver School of Pharmacy and Pharmaceutical Sciences, told Stat, I don't think we're going to get out of it in the next 2 or 3 I don't know what that, I don't think we're going to get out of it in the next 2 or 3. Oh, he's talking about decades. Okay. Woo. Okay. That's pretty bleak. If you think you're going to go a few more decades with this plague, it's not going to be anybody left. It's already so bad that once unthinkable scenes of public overdose are now common. People are dying on public buses and inside of fast food restaurants. They're collapsing unconscious on street corners and in libraries after overdosing on prescription pain pills, heroin, and fentanyl. A customer in Anchorage, Alaska, hit the floor on a subway while trying to order a sandwich. A mom in Lawrence, Massachusetts, sprawled in the toy aisle of the Family Dollar as her little girl screamed at her to wake up. A grandmother in Liverpool, Ohio, slumped in the front seat of an idling car, turning blue, while a toddler in dinosaur pajamas sat in the back seat. There are so many deaths. Some coroners are running out of room for bodies. The recent national statistics count more than 33,000 opioid-related deaths across the U.S. in 2015. Many victims are young, often in their 20s or 30s. Increasingly, many are white. But the plague touches, they said the word plague, y'all, woo! But the plague touches all demographics, farmers and musicians, lawyers and construction workers, stay-at-home moms, and homeless. I told you, they kept saying it was the whites without education, or the ones that had high school or less. But now you see it's clearly across all economic lines. So it's no longer just poor people and deaths of despair. It's hitting even lawyers and construction workers and all that. Okay. Most of the forecasts produced by STAT predict the annual death toll will increase by at least 35% between 2015 and 2027. Under the gravest scenario, it could triple to more than 93,000 deaths per year. Oh my God. These people, they ain't gonna make it, y'all. They are not gonna make it. On this, all experts agree fatal overdoses will not even begin to level off until sometime after 2020, because it will take time to see whether the federal government efforts to boost drug enforcement and push doctors to write fewer prescriptions for opioid pain pills are effective. It ain't going to work. If they can't get the pain pills from the doctor, they're going to go in the streets and get the heroin. We're already seeing that happen now. And plus, what are you going to do with China shipping all the fentanyl over here by mail that can't even be detected by dogs? Okay, they can't detect it at all, even with their best equipment. The worst case scenario is built around the assumption doctors will continue to freely prescribe and that people addicted to opioids will continue to be exposed, perhaps unknowingly, to powerful synthetic compounds like carfentanil and an elephant tranquilizer capable of killing a human with just a couple of grains. Okay. The best case projection has fatal overdose falling below 22,000 a year by 2027, but experts say reaching that level could require a major public investment in evidence-based treatment options and a concerted push among medical providers to control pain with non-narcotic therapies before trying prescription opioids. Right now, the U.S. spends about $36 billion a year on addiction treatment, and just a fraction of those in need are getting better. Many of them don't. The vast majority of them don't. Okay, they can't kick their habit. It is really very difficult for them to do that. By contrast, federal officials estimate that opioid abuse drains nearly $80 billion a year from the American economy because of expenses tied to the health care, criminal justice, and loss of productivity. This is, again, why you're going to hear more and more of these politicians talking about letting these people go. Okay? Like I said before, not unless they got a bottomless pit of money that we don't know about. That's a lot of money to go through every year. 80 billion. We're already up to 51 billion a year. So if they're estimating it can go up to 80 billion a year, these people dragging down the economy by that kind of money, whew. Hey, y'all, if we do our boycott on top of that, America's gone. Think of something, black people. Think of something. President Trump, who has vowed to make opioids a priority, has appointed a commission led by New Jersey Governor Chris Christie to explore solutions, but it hasn't yet laid out its idea. And in the meantime, the administration proposed budget would slash most domestic spending, which health advocates call profoundly counterproductive. Are we doing enough of what we think works? Prescription drug monitoring programs, medication-assisted treatment, naloxone, asks Dr. Ronald Burke, Dean of the University of Pittsburgh Graduate School of Public Health. And Burke said, are we matching the socialite costs with like expenditures in prevention? So, I mean, they're hoping to get the deaths down, but right now I can tell you, I really don't think it happened. It's going to happen because the more a drug addict can't get a hold of the opioid pills, they just won't go out to the street drug. I mean, you're only talking about stopping it at the doctor level. I mean, you're not talking about stopping it at the street level, which is impossible. America has never stopped drugs from coming in. So what if you close it off at the doctor's level? If you still got all the drugs on the street, how is that going to put a dent in anything? I'm just saying. The Stats Analysis Project, many painful years ahead, the roots of the crisis through stretch back generations to the 80s, when pharmaceutical firms first marketed prescription opioids like oxycodone and hydrocodone to treat pain and claimed they carried minimal risk for addiction. Over the years, these companies pushed hard to get pills in patients' hands with strategies that included paying middlemen to circumvent state regulations and allegedly bribing doctors to prescribe opioids. The results are staggering. Opioid prescriptions nearly tripled between 1991 and 2011. It has been abundantly clear in recent years that such prescriptions can be dangerous. From 2005 to 2014, the rate of opioid-related emergency department visits nearly doubled, according to a new report from the Agency for Healthcare Research and Quality. Yet, recently in 2015, doctors prescribed prescription painkillers to more than a third of American adults, despite limited upsides for many patients. It's like cigarettes in the 50s. We look back at the way people smoked and promoted cigarettes as laughably backwards. Magazine ads with doctors saying physicians prefer Camels. Dr. Michael Bennett, assistant professor of health policy and management of Harvard University, said, "We have the same thing now. Oxycontin ads in medical journals where doctors say opioids are good for treating pain. They don't have addictive potential. it's possible 20 years from now, we're going to look back, and I cannot believe we promoted these dangerous, addictive medications that are only marginal, more effective. Shoot, 20 years from now, you may have a whole new drug out there. They come out with these new drugs all the time. The state of Ohio, among a handful of governments currently suing drug makers, allege that a well-funded marketing scheme led to its residents receiving 3.8 billion opioid pills from 2011 to 2015, fueling human tragedy of epic proportion. Fatal drug overdoses in Ohio have soared by 642%. Wow. Wow. Since the turn of the millennium. Another statistic, the number of privately insured patients diagnosed with opioid dependence increased nearly six-fold in just 5 years, according to data compiled by Amino, a healthcare data analytic company. In 2012, only 241,000 such patients had an opioid dependency diagnosis. By 2016, that number was 1.4 million. And those numbers don't account for the hundreds of thousands more battling addiction while on Medicaid or Medicare, or while uninsured. Wow. The surging death toll affecting growing numbers of white Americans sparked demand for action in ways unseen during past epidemics that disproportionately affected minority populations. Duh, I wonder why. Law enforcement officers started shutting down pain clinics known as pill mills, where doctors accepted cash for painkiller prescriptions. But that only accelerated demand for heroin, as pill mill patients had trouble finding treatment to break free from their addiction. Desperate to keep feeding their cravings and avoiding the anguish of withdrawal, people from all walks of life, soccer moms in Vermont, C-suite executives in California, college-bound kids in West Virginia began to shift from prescription pills to heroin, which was more potent and had become far cheaper thanks to heightened drug trafficking into the U.S. by cartels. 2 years ago, heroin deaths surpassed the toll from prescription opioids for a first time this millennium, according to the Washington Post. 30 years ago, the heroin dealers drove through Arkansas on their way to more populous and lucrative markets. Dr. G.R. Richard Smith, professor of psychiatry, medicine, and public health at the University of Arkansas for medicine, medical science, told Stats. That's not the case now. People are switching from legal prescription meds, rightly or wrongly prescribed, to heroin. Yeah, because that's what's going to happen. I mean, they keep talking about stopping the doctors from writing so many scripts, but what they're leaving out is, what about the street drug? If they can access the street drug, how is that going to slow them down? It's not. And they have no incentive of getting off of these drugs when you're coddling them and saying it's a public health issue. If I was an addict and you kept patting me on the head saying it's a public health issue and allowing me to stay on the streets to get the drugs, why should I get off of them? These people are really silly. Let me see what it says towards the end. Okay, so what I'm going to do, I'm going to leave this link in the description box. And you can go out here and access this article and read through it. And it's just going over like certain towns and how many overdoses that they have, and 911 dispatches and things like that. So, and we all generally know that, that's the case from my previous articles on opioids. So it's not getting better. So now they're talking about the death tolls are nearly 100 per day. So it's not getting better, y'all. It's getting worse. And to be honest with you, I don't care how much they keep holding back on the scripts. These people are going to find a way. Professor of psychiatry, medicine, and public health at the University of Arkansas for medicine, medical science told Stats. That's not the case now. People are switching from legal prescription meds, rightly or wrongly prescribed, to heroin. Yeah, because that's what's going to happen. I mean, they keep talking about stopping the doctors from writing so many scripts, but what they're leaving out is, what about the street drug? If they can access the street drug, how is that going to slow them down? It's not. And they have no incentive of getting off of these drugs when you're coddling them and saying it's a public health issue. If I was an addict and you kept patting me on the head saying it's a public health issue and allowing me to stay on the streets to get the drugs, why should I get off of them? These people are really silly. Let me see what it says towards the end. Okay, so what I'm going to do, I'm going to leave this link in the description box, and you can go out here and access this article and read through it. And it's just going over like certain towns and how many overdoses that they have, and 911 dispatches and things like that. So, and we all generally know that, that's the case from my previous articles on opioids. So it's not getting better. So now they're talking about the death tolls are nearly 100 per day. So it's not getting better, y'all. It's getting worse. And to be honest with you, I don't care how much they keep holding back on the scripts. These people are going to find a way to get to some type of alternative drug. It's just going to make fentanyl and the carfentanil more popular. To get to some type of alternative drug. It's just going to make fentanyl and the carfentanil more popular. And of course, the heroin. Please leave your comments and subscribe. And if you can donate to this channel, please do. And I also want to say thank you for all of you that have become patrons and also given donations on GoFundMe. Your help is deeply appreciated, and you just can't imagine how much I love and appreciate each one of you that have helped out. Peace, family. And of course, the heroin. Please leave your comments and subscribe. And if you can donate to this channel, please do. And I also want to say thank you for all of you that have become patrons and also given donations on GoFundMe. Your help is deeply appreciated, and you just can't imagine how much I love and appreciate each one of you that have helped out. Peace, family. I want to thank Craig Jarrett for sending this story. And, I kind of knew this was going to happen, and I have spoken about this before, where the addicts are such a strain on the economy, where you may have to let a lot of them go, especially if they keep repeating their overdose over and over, which many of them are. And even the emergency rooms are saying they see the same person overdosing several times in 1 week. You know how much, you can imagine the amount of Narcan they got to use on just that one person. And if they're using fentanyl, that takes even more doses to bring them back. If they can bring them back, because in many cases, they don't even respond to the Narcan and they just go. And if you remember, I did an article saying that it's costing $51 billion just so they can run out here and keep trying to help these people. I mean, you have to think about all the ones that go to rehab and they're using insurance and they fail. So now you're dealing with a situation with them running back out to the drugs. The police, you got to pay the fire department, the EMTs, and they're constantly in and out of these emergency rooms. And you got to think about some of them need a hospital stay. You got to get the coroner's office involved, the medical examiner, the autopsy. And there are some states like West Virginia that do burials for these people. It's a major strain. And then you got to also set funding aside just so you can keep a stockpile of Narcan available. And you're treating the same people over and over and over and over. That is a strain. And they are a public nuisance. They're all over the road causing accidents and deaths. They're running people over. They're killing people on the highway with their cars. It's ridiculous. And drug driving now has long surpassed drunk driving. It's a major strain on the economy. And then you also got to consider the fact many of them don't have jobs because they're junkies. So that's less money going into the economy and they're straining the resources. Ohio lawmakers suggest letting people die if they overdose twice. It's a third strike, no ambulance for you. An Ohio councilman believed that having an opioid addiction should be a death sentence. He wants to create a 3 strikes policy in which anyone that states Middletown who has overdosed twice before would not receive emergency care because it's costing the city too much. Dan Pickard told the local Journal News, "I want to send a message to the world that you don't want to come to Middletown to overdose because someone might not come with Narcan and save your life. We need to put a fear about overdosing in Middletown." He asked the city to explore the legality of the proposal. This is about as sensible as Trump's opioid commission member and advisor Kellyanne Conway recently commented that the solution to the opioid crisis is will. What will? Your junkies are the weakest people in the world. They don't have no damn will. What is she talking about? And shows just about as much understanding of the disorder. It's because people are getting frustrated and they don't want to spend no more time on these junkies. And I'm telling you, you may think these people sound crazy now. Give it more time. They won't sound so crazy after all. It's going to be a lot of people jumping on this bandwagon. And I could bet there's probably a lot of people thinking that way right now. They just haven't come out publicly yet to say anything. But don't worry, Dan. No one wants to come to your nowhere little town to overdose, even if it's where best-selling hillbilly elegy author J.D. Vance grew up. People who are overdosing there are your neighbors and their friends, families, and loved ones, maybe even your own family members or their friends whom, given your level of compassion, are unlikely to discuss their problems with you. To be honest with you, I wouldn't want no junkie in my face, none of these whining about their problems to me. So, um, no, don't come whining to me either. Everyone tries to claim that people with addiction are outsiders or transients, but that's not what even a quick read of the journal news recent covers suggests. And people with addiction are not choosing to overdose repeatedly because they enjoy it. Yes, they do. Yes, they do. I read an article where heroin addicts said they love the way the high feels. It has a euphoric feeling like they're in love. They love that feeling, so that is false what they just said. It's quite a hellish experience to be revived and put into a constant withdrawal, actually. Well, they don't, all drug addicts don't feel that way. Go and say rehab around them. I promise you, they'll cuss you out because they like being high. So I don't know who wrote this, but this author is full of shit. Instead, they're doing it because addiction itself is defined by the National Institute on Drug Abuse and Psychiatry Bible, the DSM, the compulsive drug use that continues despite negative consequences. Well, many of them are, addicted and it's compulsive, but I still say many of them enjoy that high. That's why when they run out of the opioid, they run out there to the heroin because they want to maintain that high. In other words, if fear, punishment, and consequences could stop addiction by definition, the problem wouldn't exist. We've tried for at least the past 100 years to fight a problem defined by its resistance to punish with whatever more punishment, in the same way that people with addiction continually up the dose in hopes that this time maybe they'll be able to feel okay again. Well, you were all into punishing the crack addicts. I don't feel anything for you. It doesn't work because it can't work. People with addiction takes drugs because they are attempting to cope with emotional pain, typically due to childhood trauma, mental illness, oh my goodness, economic and cultural displacement, or frequently all of the above. You see how they got an excuse for everything? When it was the crack addiction, it was no excuse. Every damn body went to jail. No excuse. They didn't want to hear nothing you had to say. Unbelievable. Adding more pain only adds more fuel to the addictive fire. No one would ever say we should stop reviving heart attack or stroke victims because they've kept eating French fries or because they didn't exercise as much as we all know we should. Yeah, but those are diseases. And I realize you classify an addiction as a disease, but see, the only reason why you're doing that is because it's impacting mostly Caucasians. When the addiction was mostly affecting Black people, you were calling it a crime. This is why it's very difficult for a large segment out in the public to feel sorry for you. And many don't. In fact, many of your own people don't feel sorry for you because I've seen it in these videos. They sitting there laughing and chuckling and even sometimes playing around with the addict. No one is suggesting that not treating lung cancer as a way to get people to quit smoking. That's totally different. And not treating people who were speeding when their car crashed. We don't suggest these things because we recognize the humanity of people who overeat and under-exercise, people who can't quit smoking, people who speed. No, you didn't recognize the humanity of the crack addict. And even when our mothers had babies that were addicted to crack, you called them crack babies. But I notice your babies, you're not quick to give them a name. We know that they're just like us. No, they're not. I am not like no heroin addict, and they're nothing like me. But until we recognize that, the same thing is true for other kinds of addiction. We're not going to make any real progress in cutting the death toll. No, you're going to have to make a tough decision, whether you got this argument or not. They are a strain on society, and they are not adding anything to society because, like I said, many of them are not working. They can't keep jobs because of their addiction. So not unless you got a bottomless pit of money, you better come up with a solution or that work. And plus, I think, right now I was reading there's a large turnover in police departments. They can't keep people like they used to. And I'm not going to be surprised if a lot of these jobs, people walk away from them because they're going to get sick of these addicts. Many of them are probably sick of them already. I mean, how much more are you going to keep treating the same people? It costs money when you walk into an emergency room or stay at a hospital because you now have breathing problems because of your overdose. It costs money to call ambulances to get you out to wherever location these addicts are that have overdosed. Even when they die, it costs the coroner and medical examiner offices because autopsies got to be done on all of these people. And you see what's happening with jobs. They can hardly fill positions like they used to because so many of these junkies are failing the drug tests. And those drug tests cost the company. If they're not charging you, it's charging the company for all of those failed drug tests. But tell me what you think. Please leave your comments and subscribe. And if you can donate to this channel, please do. Peace, family. Okay, I'm bringing this next story to you. A U.S. opioid epidemic hit Staten Island funeral homes hard. Director turns activist. And thank you, Claude Black, for this story. I really appreciate it. I'm going to go ahead and do this. When Kevin Moran speaks to young people, he unscrolls about a dozen letter-sized papers taped together and holds them squarely in front of them. And what these are, when he's holding it up, are death certificates of many people that have died from accidental overdose on opioids. So many of these people, and I believe like when they talk about the tainted batch, it's really fentanyl. Fentanyl is the one thing that they mix in to these batches that kill many of these young people. So he's yelling at them, "Don't do it," Moran yells at the audience in one of his talks last year. "I don't want to see you in my funeral home. I'm here for one reason.
The drug
I'm here for one reason, and that's to scare the living crap out of you. If you want to come by the funeral home when I have a drug overdose case, I'll bring you. I'll show you what the person looks like, and I'll show you what the family goes through, and you watch it, and then tell me you want to do it. You know, unfortunately, I hear where he's going with this, but believe me, even showing a dead body to a junkie is not going to inspire them to get off of drugs. Okay, you can't even get these people into rehab. Do you really think, even if you scare them into looking at dead bodies and looking at the grieving family, they're going to stop? They're not. They're not, ladies and gentlemen. They are so hooked on these drugs that, you know, if they really in their hearts don't want to get off of the drug, even when they hear about other people dying, they're just not going to do it. The toll of the opioid epidemic that has dripped communities across the United States began making itself felt in Staten Island about 3 years ago, when the bodies of people barely old enough to drive or buy a beer began appearing in larger and larger numbers at the St. John Scalia Home for Funerals in this New York City borough, where many residents work in public service. So it was around 2014 is when they start seeing their highest amounts of casualties to the opioid plague that's going on in the country. So he's talking the casualties of opioid addiction at the funeral home began to appear at a rate of 1 every 4 to 6 weeks. Every one of Staten Island's 13 funeral homes had similar experiences. Last year, accidental overdose in Staten Island accounted for the deaths of more than 100 people, a jump of 35% over 2015, according to health officials. Nationwide, 52,404 people died from a drug overdose, up from 47,055 in 2014, according to the Centers for Disease Control. A majority of 63% of the deaths involved in opioids. So, you know, he's just talking about how emotionally he's about it, you know, and he's a parent and blah, blah, blah. But, you know, we saw none of this empathy during the crack epidemic. Never lose sight of that, ladies and gentlemen. We saw none of this. They were glad to throw you in jail and not care that you were struggling with drug addiction, and maybe that had everything to do with you committing a crime in the first place. They didn't want to hear it. But with them, they want to love them. They want to embrace them. They want to get in front of them and give them hand-holding talks and pat them on the head and tell them, oh, you know, you be all right. But nobody did that. I don't remember anybody from the Caucasoid community coming into the Black community to talk us out of doing crack. You were quite fine with the whole thing. Okay? But you now have an issue and you want understanding from everybody else that it's a public health issue. Sorry, but let me go ahead and play this video.
Epidemic is so different than any others. My name is Kevin Moran, and I'm one of the funeral directors here at Scalia Funeral Home in Staten Island. When you have a death of a young child, a teenager, a young adult, and you listen to the talk in the room, it's what they've been deprived of, what they will be missing out on. Parents would be possibly losing the ability to have grandchildren. A father is missing the opportunity to walk his daughter down the aisle. Graduations. All those things that make family memories. As we got into 2015, it became much more prevalent. And not only here, but most funeral homes on Staten Island. There is no socioeconomic barrier. You could be the wealthiest kid and the poorest kid, and drugs don't care. Today, the drug user is a person in a suit, is a professional, could be an accountant, could be a lawyer, and the person selling the pills could be your next door neighbor. And that's the scary part. It's the effect of throwing a rock into the water. And it is amazing how many people's lives are impacted and affected by someone using drugs. Drug addiction is a disease like cancer, and you need to treat the disease. The world in 2017 is not designed for parents to bury their children. If you want to see your son or your daughter, you're not going to see them at the dining room table. You're not going to be watching television. You're going to go stand on a piece of grass and look at a 3-foot-high piece of granite. That's where you see your child. The very fabric of me is just torn apart when I see these deaths occurring, and most of them can be prevented. They don't have to happen. There are avoidable deaths.
No, he's right. But where were all these funeral directors during the crack epidemic? Did anybody recall all these white funeral directors coming forward and speaking when we were going through it? I don't remember this. And I don't remember seeing anybody except for the police show up for the crack epidemic. Okay. But now they want all of this public awareness to their drug addiction. Well, I don't have anything to give as far as sympathy is concerned, but I feel bad, but not bad enough where I want to reach out to any of these junkies. You know, they watched our crack addicts die and get placed in jail, and we didn't hear not one murmur from the Caucasoid community. In fact, they were applauding the police for putting us in jail. Now you are going through probably one of the most devastating drug plagues that ever hit this country. Don't turn your face to look at Black people for empathy now. I don't have any to give you, and I won't give it. Like Tareen Rain said, I feel nothing. Please leave your comment and subscribe, and if you can donate to this channel, please do. Peace, family. It's time for me to do another bank robbery video due to heroin addiction, and I'm just showing you robberies that were published for the month of June. Okay, I'm sure there are a lot more locally that just have not been published online, but as drug addiction grows, the robberies for banks, pharmacies, and even people's homes are going up because of these addicts. And this one comes out of Morristown. I believe this is in New Jersey. And this man robbed a TD Bank. It says right here, a former advertising designer who became addicted to heroin has been charged with robbing TD Bank in Manhattan 5 days before he allegedly held up TD Bank on South Street in Morristown for $688 last week, attorney said Wednesday. And there's a video here. I'm going to go ahead and play the video.
Zachary Zingali, a Morristown resident charged with robbing TD Bank in town on June 16th, has been ordered held in the Morris County Jail while the charges are pending.
I will just note that give an update to the state's filing. The defendant was also charged in New York City with a robbery, it's called robbery in the third degree. I understand it's a Class C felony, also for an alleged bank robbery.
Zingali also must undergo a substance abuse evaluation.
And for today's purposes, you're stipulating that probable cause does exist for the crimes you're charged with. Is that correct?
Yes.
All right, Mr.
Zingali, do you have any questions with regard? I do not.
Okay, there you go. You see they are still out here robbing. He looks like such a goofball. And now you have this older guy right here, Virginia, man confesses to 2 robberies, freeing innocent man from prison. And look how old this dude is. He's addicted to heroin. All right. It says Christian Amos turned himself in for old bank robberies, which he committed to meet his drug habit, and he got away with. He serves his sentence in Riverside Regional Jail now. All right, so he almost got away with murder. He literally had to confess. He's 63 years old. Wow. 63 years old. And it was another guy in prison named Gary Bush, 67 years old, who they actually pinned the crime on, but he didn't do it. This dude did. Drug addiction. Wow. And I will leave all of these articles in the description box, everybody, so you'll be able to look at them for yourself. And this is 2 men arrested for an Avoca bank robbery. All right. And you can see they're all covered up. And it looks like this robbery took place on the 21st of June. All right, and it says the FBI arrested 2 men early Thursday on charges stemming from a bank robbery that occurred just before 4 p.m. on Wednesday at PNC Bank at 650 Main Street, Avoca. Okay, Avoca, I guess. Douglas A. Sickler Jr., 36, of Hanover Township, and Sean James Kavanaugh, 35, of Wilkesboro. That's over in Pennsylvania. Okay, I know where this is. Were arrested according to the Avoca police. Okay. And it has them listed, when I pulled up robberies and heroin addiction, this one came up. So this is probably why these 2 robbed the bank, the PNC Bank over there in Pennsylvania. Wow. Okay, so here's another one. Prosecutors say police shooting of bank robbery suspect in Old Saybrook was justified. Okay, and this guy went in and robbed the bank, and of course he got caught by the police SWAT team, and they actually killed him. I believe he got shot in the head. Okay. And this person was also known to be addicted to heroin. Again, I will leave this in the description box. And some of these guys have a long track record. These cops know who they are. Here's another one. This one's out of Kentucky. KSP make arrest in First National Bank robbery. Okay, and this guy looked like he robbed the bank on June 13th in Kentucky. And it says right here, I guess his name is Hupp, Charles A. Hupp. Hupp, 42 years old, was arrested without incident, lodged in the Carter County Detention Center, and charged with the following: robbery in the first degree, theft by unlawful taking of an automobile, so he stole a car, robbery in the second degree, attempted, persistent felony offender, possession of a handgun by a convicted felon, trafficking a controlled substance, in the first degree, first offense, less than or equal to 2 milligrams of heroin and methamphetamines, drug paraphernalia, possession of a controlled substance in the second degree, 2 additional counts of being persistent felony offender and bail jumping in the first degree. So here's another junkie robbing a bank. And this last guy, heroin user, faces jail for robbing man and burglarizing homes. So he was breaking into homes. I don't know why they're not showing his face, and they got him in this profile picture. They should be showing his face. A heroin addict faces jailed after he admitted robbing a man and burglarizing 2 homes. See, this is why I'm telling y'all, if you live, I don't mean no harm, but if you live in a neighborhood where there's a lot of caucasoids, you better be locking up every single day and night. Prolific criminal Sean Webb, 35 years old, confessed to a string of offenses between January and May. He remains behind bars until Friday, when a judge has promised him a prison term of note. Homeless Webb appeared via video link in Plymouth Crown Court from Exeter prison, and to admit robbing a man of cash on January 20th. All right. So he pleaded guilty of stealing the money and burglarizing this house, and he had a long battle with heroin. So again, please be careful, ladies and gentlemen, because as they start writing less prescription, they're going to become more desperate. They're not going to just stop at robbing homes and robbing banks. They're going to start snatching people's cash and money, purses, and anything they can get their hands on the streets. All right. So just be careful out there. Please leave your comments and subscribe. And if you can donate to this channel, please do. Peace, family. Got this article that is letting us know, because doctors are writing less opioid scripts, it's now sparking more pharmacy robberies among these devils. Okay, they are determined to have their opioid, whether the doctor write that script or not, they don't care. All right. Man, I tell you what, if crack addicts had done that, it would have been a trail of bodies everywhere. This is an AP article, let me see, dated June 23rd, 2017. I'll leave the link to this article in the description box. All right, as the nation opioid plague intensifies, Indiana cracked down on overprescribing doctors and pill mills, catering to people with addiction. The state also took aim at doctor shopping, the practice of visiting multiple physicians to score more painkillers. Only a devil would do that. The measures had an impact, but not what officials hoped for. While making opioid prescriptions harder to get, the crackdown also helped spur a twofold increase in robberies of pharmacies that exacerbated the state's standing as number 1 in the nation for those crimes. Between 2009 and 2016, Indiana had 651 pharmacy robberies, the most in the U.S., and more than 597 recorded by number 2, California, which has 6 times the population. The U.S. Drug Enforcement Administration record shows the frequent holdups reflect a grim reality. With each regulation or law enforcement tactic, the opioid crisis quickly shifts to evade new obstacles. Dealers and those struggling with addiction adapt, and the plague continues with little interruption. They're always looking for whatever they can get their foothold. And once they do, they're going to take advantage. A deputy of pharmaceutical investigations with the DEA in Arlington, Virginia, pharmacies with law enforcement agencies in Indianapolis, where most of the robberies have occurred, are fighting back. Pharmacy chains have installed time-release safes that won't open for several minutes, forcing robbers to risk by waiting. Signs so far are positive. Robberies in Indianapolis numbered only 8 through early June compared to 55 for all of 2016. But some criminals responded to those efforts by traveling from Indianapolis to small suburban towns to rob pharmacies, including one in January in Elwood, about 40 miles from Indianapolis, where 2 robbers herded frantic employees into the bathroom after threatening them with a handgun. And that's another thing. Those heroin addicts, they sure enough all know they got a handgun, and they go in there and put that gun in everybody's face up in that pharmacy. Indiana economic makeup has made it a likely breeding ground for opioid addiction for years. The 2008 financial crisis hit the state manufacturing economy hard, causing waves of layoffs. The physically demanding job in heavy industry have long left workers prone to injuries that could lead to prescriptions for painkillers. They get a legit medical prescription, and then all of a sudden it gets out of control, said Jason Huckleberry, an Emory Hospital professor of health policies who has studied opioid addiction. He said the state already had outsized opioid woes related in part of its location along Interstate 65 through 70 and 2 major corridors for illicit drugs. Opioid addiction was behind the state's worst ever HIV outbreak in 2015, a plague that infected more than 200 people in rural country north Louisville, Kentucky. The most had shared needles while injecting a prescription painkiller. That year, Indiana ranked 17th in the nation in heroin and prescription opioid deaths, with 1,245 deaths per 100,000 people. 4 years ago, the legislature directed the state's medical license board to draft rules requiring patients to visit their doctors periodically to keep their prescription refills. The changes included requiring doctors to use online database to check patients' use of controlled substances. But stemming easy access to opioid probably contributed to the binge of 168 robberies in 2015, more than twice the previous year total, as more people addicted to prescription opioids robbed stores seeking painkillers and other potent drugs, said Greg Zoeller, who was Indiana's Attorney General at the time. So as you can see, as they're pulling back on writing scripts, it's just causing people to rob the pharmacies even more. The holdups, sometimes more than 5 a day in Indianapolis, flooded the black market with nearly 200,000 pills, primarily painkillers. We knew full well that if you reduce easy access, they're going to have these kinds of consequences, Zoella said. Lieutenant Craig McCart, who oversees robberies investigations for Indianapolis Metropolitan Police Department, said 85% of Indianapolis pharmacy robberies in 2015 were committed by juveniles, enlisted by adult dealers offering cash and gifts to rob stores. Wow, you got the teenagers in there robbing stores. Amid the crime spree, Indianapolis police teamed up with DEA, FBI, and the federal prosecutors for multi-agency approach that led to the indictment of 35 people, including 6 juveniles, in 62 of the robberies. The state's 2 largest drugstore operators, Walgreens and CVS, have also installed time-release safes at their roughly 180 Minneapolis pharmacies and added armed guards at some stores in recent years. Indianapolis pharmacy robberies dropped to 78 in 2016, but the state still ranks second in the U.S. behind California. The latest efforts targeting the robberies is a law taking effect in July that will lead to longer sentences for people who threaten violence or injure anyone during pharmacy robberies. Ken Fagerman, a former South Bend pharmacist who wrote a book about the robberies, said the pharmacy industry should not have tolerated the heist for years and shares some blame. No, they tolerated it because these were mainly Caucasoids doing these robberies. Oh, you see that? The stores don't mind getting robbed as long as it's a bunch of white people doing it. Unbelievable. It's regrettable that more wasn't done sooner, he said. All right. So that's Indianapolis. The pharmacy robberies are going through the roof. All right. Please leave your comments and subscribe. And if you can support this channel, please do. Peace, family. I have another story where an officer got exposed to a fentanyl drug and had to be taken to a hospital. This is starting to become commonplace because of the plague that's going on in the country. Fostoria cop treated after exposure to fentanyl drug, and this is in the Courier. And this story just came out June 23rd, 2017. A Fostoria police officer was accidentally exposed to the opioid fentanyl during an arrest Thursday afternoon, is recovering at home after being treated at a hospital. The patrolman came in contact with what is believed to be the powerful pain medication during a routine traffic stop near the intersection of West Lyle and South Main Streets in Fostoria. Fostoria Police Chief Keith Loreno said the officer pulled over 27-year-old Logan T. Parrish of Findlay about 5 p.m., and the officer discovered a large quantity of what is believed was fentanyl in the vehicle. The officer, who Loreno declined to name Thursday night, put on gloves before searching both the vehicle and the suspect. But during the search of the vehicle, the officer came in contact with the drug and began to exhibit symptoms of exposure. A second patrolman on the scene immediately called for Fostoria Fire Division EMS squad, which arrived minutes later and transported him to ProMedica Fostoria County Hospital for emergency evaluation. Paramedics gave the officer a dose of Narcan, an FDA-approved nasal spray that can reverse the effects of opioid exposure. The officer was treated by physicians and released several hours later. I can tell you the range of emotions I felt getting the call when we had an officer down as a result of this. I am extremely thankful he is home and recovering, Loreno said Thursday night. This just shows that we cannot be tolerant of those criminals contaminating our community with these poisons. Police cannot confirm the substance discovered inside the car was fentanyl until the Ohio Bureau of Criminal Investigation completes a lab analysis. However, Loreno said Parrish admitted that what it was. So apparently the guy that he had been transporting that in his car. So he just confirmed it. Fentanyl has played a large part in the deadly opioid plague. In an effort to deliver a longer, more powerful high, drug dealers often lace heroin with fentanyl. Since the drug can be produced and distributed in mass quantities, fentanyl has evolved into a cheaper alternative to heroin. According to the Drug Enforcement Agency, fentanyl is 30 to 50 times more potent than heroin and 50 to 100 times more powerful than morphine. The drug can potentially be lethal, even in small amounts. The Center for Disease Control and Prevention reports that Ohio experienced a 107.3% increase in overdose deaths related to synthetic opioids, such as fentanyl, between 2014 and 2015. The number of fentanyl-related overdoses in Ohio more than doubled from 503 in 2014 and 1,155 in 2015, according to the Department of Health. In fact, unintentional drug overdoses were the leading cause of injury-related deaths in Ohio in 2015, ahead of motor vehicle crashes. If it hadn't been for those two officers, there may have been a death, a lot of dead people in the area right now, if Parrish was able to distribute it, Loreno said. I can't tell you how proud I am of the officers, whatever. Thursday incident serves as a reminder of the struggle police department, large and small, face as a result of the nation's soaring drug plague, with Fostoria Police Division already well below its staffing level. So I'm telling you guys, the understaffing of cops is nationwide, but they sure still know how to find their way to us to shoot, right? Loreno said there's a need for more officers on the road. It is as crucial now as it has been. And that's all he's just talking about. The Parrish was charged with felonious drug possession, but additional charges are pending. He is being held in the Seneca County Jail until his court appearance. So I believe this place is in Ohio, which is really having a terrible epidemic problem alone in that state, probably higher than anywhere else. But as you see, more cops are being exposed to the drug and overdosing just from searching cars and searching suspects. Oh well, but like I said, my prediction still stands. I believe many of these cops in the future are going to resign. It's not going to be because they're dealing with us, the Black community. It's going to be because of these drug addicts and all the risk of being around the drug. Please leave your comment and subscribe, and if you can, donate to this channel. Peace, family. Okay, this is a new article that just came out in Mother Jones on the 20th of June, 2017. People addicted to opioids are 9 times more likely to have hepatitis C. and other many illnesses too. More reason to stay away from these junkies. Americans diagnosed with opioid addiction are far more likely to suffer from a host of other health conditions, from hepatitis C to alcoholism to back pain. That's according to a new report from Amino, a health tech company that matches patients with doctors. The company examined health insurance claims of more than 300 million patients with private health care insurance between 2014 and 2016, and compared with diagnosis from those with opioid use disorder to the general population. And as you can see on this chart, the leading disease a lot of these heroin users now have is your hepatitis C, and next, chronic pain, alcoholism, suicidal. Wow. Ideation, binge drinking, bipolar disorder, failed back syndrome. Okay, that seems to be something associated with back surgeries. Inflammatory back condition, pre-existing. Wow, these people are, oh, wow. Well, what do you expect? The drug is tearing down your body. I mean, nothing good can come of that when you have so many people doing the drug. I mean, seriously, what do you expect? As the chart above shows, addiction to opioids, including painkillers, heroin, and fentanyl, is seldom the only mental or behavioral health issue at hand. Those with opioid disorder are 8.4 times more likely to suffer from alcoholism, 6.9 times more likely to experience suicidal ideation. Wow. Well, what? They're not doing nothing with their lives but being high. Oh, wow. 4.2 times more likely to have post-traumatic stress disorder compared to the general population. The study didn't examine whether opioid addiction was caused by or caused the other diagnosis, but some of the conditions like hepatitis C are often a result of the needle sharing that can come with opioid use. More and more Americans inject opioids, particularly heroin, and hepatitis C rates have soared. The number of new infections tripled between 2010 and 2015, according to a recent report from the Center for Disease Control and Prevention. Other diagnoses like chronic pain and failed back syndrome or pain after back surgery could be the reason the patients got started taking opioids to begin with. For years, opioid painkillers were aggressively marketed and liberally prescribed to those with chronic pain. But there's a slant evidence that the painkillers work when prescriptions for long periods of time, when prescribed for long periods of time. According to the CDC opioid prescribing guidelines released last spring, opioids should be prescribed for chronic pain only after other solutions like amphetamines, I guess Tylenol, and physical therapy have been considered. So, another reason to stay away from these junkies. Hepatitis C is soaring among them, and they're going to share needles because, as you know, people are going to pull back on helping these junkies out here as these diseases spread. So I'm just letting you know, as a precaution, just stay clear from these people. Please leave your comment and subscribe. And if you can, donate to this channel. Peace, family.